Good evening, everyone. We're going to bring this meeting to order. The first item here is a special session, and I need to entertain a motion to go into special session.
So moved.
Just unplug it. Yeah, just turn it on. I'm sorry, who made that motion? Mr. Brubaker made the motion. Is there a second? Mr. Metzner made the second. Anyone want to discuss going into special session? All those in favor of going into special session, please say aye. Aye. Any opposed, say no. We are now in special session for a public hearing to consider a temporary moratorium on the ambulatory healthcare services in the CCMU zoning district. I believe staff are going to make a presentation, and then the goal of this hearing is to ultimately hear from the public, and so you will likely not hear a lot from us about this. We want to hear from you. Please, Ms. Maher.
All right, good afternoon. Just wanted to start with a little background. The city has been working very hard to implement our community's long-range planning goals and visions for the downtown. Our public and private partners have been investing in...
Pull the mic up a little bit. Thank you.
Our public and private partners have been investing in projects to implement this plan. Broadly stated, this plan is to nurture a center for arts, entertainment, and education in the downtown, and to increase the demand for ground floor retail space and upper floor commercial, offices, and market rate residential units. A few examples of city efforts to implement our downtown plan: we've hired urban partners to conduct an economic analysis of recommended strategies in our plan and recommended catalyst projects to implement the plan. Our economic development staff are engaged daily in efforts to retain and recruit enterprises compatible with our vision for the downtown. And planning staff periodically assess the land use codes that the city has to determine if they adequately protect the quality of life downtown to create an environment conducive to implementing our vision for the downtown. Currently, it's again that time, periodically reviewing our codes. We're working on a package of text amendments to address issues that we're looking at that we feel are not compatible with our efforts to build a quality of life downtown that is attractive to residents and patrons of the arts, cultural, education, entertainment, and business enterprises we are recruiting and nurturing in the downtown. We believe if incompatible uses remain unchecked, it would jeopardize public and private investments made to implement our vision of an economically viable regional A&E district and hamper our efforts to attract new investment enterprises that are compatible with this vision. Urban Partners' public input process over and over again was hearing negative quality of life observations associated with concentrations of low-income housing and social service agencies and the perception that downtown is not safe. Quality of life issues coming up again and again. Zoning controls are a reasonable and expected use of our police powers to protect the quality of life and public and private investment made to implement our long-range plan for the downtown and the city as a whole. In the past 10 years, $72 million has been invested by the private and public sector on projects intended to implement this vision for the downtown. A few examples of public sector projects are the University System of Maryland Center at Hagerstown, the Barbara Ingram School for the Arts, the library expansion, which just opened this past year, University Plaza, the A&E District parking deck. I could go on and on. Public-private partnership highlights include the Academy Theater, acquisition and rehab of buildings such as 140 South Potomac Street and 41 North Potomac Street. Private sector highlights include the Discovery Station project in West Washington Street, the Darby condominiums on Antietam Street, and various business openings and renovation projects downtown. The amendments are intended to protect these investments and interests by developing appropriate controls and measures that encourage activity that supports our long-range plan and deters activity that is counter to the quality of life we are trying to build and discourages people from coming downtown to dine, shop, take classes, go to the library, attend events, etc. Staff are looking at a number of strategies to address these issues, including encouragement of storefront users with higher foot traffic that are incompatible with our goals for the downtown, prevention of uses that draw clientele or create an image that discourage people from coming downtown. The immediate issue before us tonight is that staff are recommending that the mayor and council take immediate action to protect our efforts by imposing a temporary moratorium on a land use category that is particularly problematic for the city center in the very near term. This category is ambulatory healthcare services. This is a broad category that covers outpatient enterprises associated with healthcare. There are approximately 14 ambulatory healthcare service enterprises in the CCMU zoning district at present. We have received complaints from the business community on 2 enterprises having clientele that gather in the vicinity of the entrances to their facilities and intimidate or discourage patrons from coming downtown to conduct business, dine, shop, etc. City staff have in fact observed disruptive behavior by groups of clientele gathering at enterprises which have been the subject of complaints. Public safety and emergency personnel have been called frequently to respond to issues at some of these enterprises. The immediate issue is that 2 ambulatory healthcare service enterprises with a history of complaints and calls for service have indicated an intent to relocate and/or expand their enterprises downtown, particularly within close proximity to Public Square. We are especially troubled at the prospect of locating incompatible enterprises in close proximity to the square because the square is traversed daily by youth attending the Barbara Ingram School for the Arts, the City Ballet School, and the Evolution Rock School. Patrons of the Maryland Theater and the restaurants travel through the square to and from public parking facilities. Travelers in our community are directed to the square for the visitor center. The proposal is to pass an emergency ordinance for a 9-month moratorium on new or expansions of existing ambulatory healthcare services in the city center mixed-use zoning district. This temporary moratorium would only apply to the CCMU zoning district. Ambulatory healthcare services are currently permitted in 12 zoning districts in the city, which are served by the county commuter and close to other service agencies. The proposed moratorium will provide the city time to develop amendments to the land management code that would appropriately address the issues and concerns cited previously, as well as other issues that are adversely affecting the downtown. We are already working on potential text amendments for review with the Planning Commission this spring. What we have before us this evening is a public hearing. Staff and the city attorney are recommending that we close the hearing at the end of today's work session because we had 2 advertisements as required by state law. The first one said 7 o'clock. The second one was corrected, and when we found the agenda had been modified to 5 o'clock. And so we're suggesting we keep this hearing open to the end of the meeting so that city staff can, if anyone comes at 7, we can take their comments or advise them that the record be kept open. We also, the record will need to be kept open for 10 days following the hearing. Next Tuesday, it would be up for consideration for adoption of the ordinance by the mayor and council, and if adopted, it would become effective on May 2nd. Those are my remarks.
Thank you. At this time, we'll have citizen comments.
I should enter into the record the certification of advertisement for this public hearing.
The way this works is, I want to say all meetings are televised and recorded. Your comments will be on air and on tape and on YouTube. The way this works is we'll give each person 5 minutes. I have an iPad here. If you don't mind coming up to the podium when your name is called, state your name and your address, and then I'll put 5 minutes on the clock and spin this around. You should see a circle that goes around, and when it becomes a complete red circle, that's when your 5 minutes is up. So the first name on the list is Laverne Chappelle. Laverne?
Good evening, everyone.
Hi, Laverne.
My name is Laverne Chappell. I live at 130 South Potomac Street, Apartment 1 Rear, here in Hagerstown. I am literally in the backyard of the library. I'm here this evening because this was brought to my attention. I'm also a college graduate. I've worked in Hagerstown for 31 years. I've raised my children by myself, no problem. I am also a mental health patient. So this brought to my attention some very serious problems with me, as if you remove things, we need them. And I understand bringing new things to Hagerstown to broaden the fact. I have no problem with that. I have grandchildren. They should be allowed to see the arts, the entertainment, etc. I enjoy the arts, ballet, etc., the fine dining. But the point is, the conditions of the buildings and apartments, they're not going to allow $10.50 a month rent. You see, you're saying that low-income housing is a negative impact. Okay, some of us, that's all we can afford. Okay, and the social service agencies, where are you going to put us? Okay, I understand. I keep seeing things where we need a new parking deck. Okay, we need parking. That's not a problem. We need to have new things brought in, new businesses, new commercials. But you have plenty of buildings here. Instead of knocking them down and building other ones, you can use them. Not all of them are condemned. But in the event, if you take out public housing and low-income housing to bring these things to the area, where are we going to go? I raised my children here. I raised my grandchildren here. I pay taxes. My kids go to school, okay? And I'm upset that we may not have the ability to come to our mental health programs, and I understand that there are people who, as you put, the clientele, okay? Some of us don't like being stereotyped, okay? I don't like being called those people, and I don't like being stereotyped. Every group, religion, society has a bad apple. It's up to us to show them, hey, let's make this easier on ourselves, get to go, and if they don't like it, then they can leave. But forcing us and telling us we have to do this to allow other people to bring in things that we can't afford, how are we, the low-income people, supposed to feel? Okay, I can't afford $36 for a steak and a beer. You know, and they're all worried about the negative impact on the children at the Barbara Ingham School. I have grandchildren, as I've said, and there are negative aspects to living anywhere. But as far as Change Health, who is one of the identity from one building to another, they're literally moving across the street, okay? They're not going anywhere near the school. The crossing for the school, I've watched these children cross. They don't even go near the University of Maryland crosswalk where they should be crossing. They could go down there, cross across, and they're right there at the school. They come up to the square, cross across, and then go down. There's no need. I mean, they could go right there, and they're protected. They have auxiliary police, they have regular policemen, and everyone else guarding them, okay? My kids are just as important. I don't deny that. But like I said, I need to know that I have the ability and the mental stability to know that I can get to my programs, and I don't have to worry about going where. You know, where do you want these places to go, and where do you want us, and how do you want us to get there? And everybody said, well, there's programs for that. Well, who funds those programs? Because if they can't get the money or the funding from the city or from the county or from the state, those programs don't exist. And then we, the mental health and the low income, don't have our meds, we don't have our therapist, we don't have our way to get a better mental health, to keep and become productive members of society. Not all of us are drug addicts, alcoholic, you know, drooling like, you know, one flew over the cuckoo's nest in 1967. Okay? I can guarantee, I talked to 527 people since Friday. And since then, none of them knew I was a mental patient because they didn't even know that we had a mental health system in downtown Hagerstown. And these were people from Hagerstown, Frederick, Thurmont, even as far as Winchester. So we need to keep our programs here in town. Because, I mean, the hospital is way out of whack for anybody right now. I can't afford, I see my therapist twice a week and my psychiatrist. To run out to Robinwood, that's $17 in a cab. That's $34 a week. How'd I get back? That's $34 a day. That's $68 a week. Not on Social Security. And there's a lot of us on Social Security who live in Hagerstown who do not get low-income housing.
Thanks,
Thank you.
Laverne. The next person on the list is Christine Cassat. Did I get that right?
Yep.
Come on up. If you could restate your name and your address for the record, please.
Hi, I'm Christine Cassette. I live at 103 East Washington Street. I'm against this because I just found out my daughter was diagnosed with autism. And without a car, without anything, and you don't have the money to get the bus all the time, I'm on low-income housing. And if it wasn't for that, me and my daughter would not survive. We need to keep the mental health system inside Hagerstown. That's it. Due to the fact that a lot of people do not have the money to catch the county commuter. A lot of people don't have the money to catch a cab. Where are they going to get funding for that? For the low income? To go to these outer places. Thank you.
Thank
very
you.
much.
Next on the list is Allison Fisher. Allison?
Good evening, ladies and gentlemen. My name is Allison Fisher. I just moved into my new apartment after being homeless for a year at 202 East Washington Street, apartment number 2 in Hagerstown, Maryland. I've been a client of Change Health Behaviors since, when did y'all open? 2012. Okay. Okay. And I've been diagnosed with mental health issues since the age of 16. I am bipolar. I am not suicidal. I'm not homicidal. I don't smoke. I don't drink. I don't do illegal drugs. I take my medication, and I think I function very well in a society, other than some things that have happened to me in the past few weeks. My daughter's also a consumer of the mental health system at Change Health. She's been there for about a year now. She goes once a week, I go twice a week. And I have no problem taking her. I'm a very protective mother. I have no problem taking her downtown to the mental health system. My daughter's on the waiting list to get in Barbara Ingram School. I have no problem with her walking downtown to go to school. My daughter goes to the library 3 times a week with me, and we walk there, and we have no problem with anybody down there. Yes, I know mental health patients hang out at the library. Yes, I know homeless people hang out at the library. You're not going to get rid of the homeless. You're not going to get rid of the mentally ill. The next thing you're going to do is run the mentally ill out of Hagerstown. It's not going to happen. There's too many of us. The thing also we were talking about was when they moved the hospital. Now, I understand the hospital moved because of its own need for more space, and there was problems with the building. I understand that. But we were promised that we'd have urgent care downtown. We don't have urgent care downtown. It costs approximately $230 to take an ambulance to the hospital. More if it's not a life-threatening injury. It costs $7 in the cab to go back home. Yes, the hospital provides transportation, but we're at the little red light. I'm sorry. Am I running out of
I'm
time?
sorry. No, I actually started it late.
Okay.
You got a couple more minutes.
Okay. And that has not materialized. I would use urgent health, but I'm not riding all the way out to Pennsylvania Avenue to go to urgent health when I live downtown. So I wind up, I have a regular physician. I go to him. In fact, I go tomorrow for my regular checkup. But when I fall a lot, I need to go somewhere other than the ER. I don't need to go to the ER every time I fall. And you're not going to run the mental health people out of town. You're not going to be able to run the physically disabled people out of town. I hope you will let Change Health stay downtown, because I do have a car. I'm fortunate enough to have a car, but I don't want to have to drive with the price of gas 3 times a week out to behavioral health services. I can't afford it. And I also drive people that are consumers of mental health issues around town, out to Robinwood, out to other places where they go. And I don't get any gas money. So please keep them downtown. It'll save me money.
Thank you.
Thank you.
See, the next person on the list is Jamie Rowland. Jamie.
Good evening, Mayor and council members. My name is Jamie Rowland. I can be contacted right next door at 44 North Potomac, Suite 101. That's currently the Change Health Systems office. I am an LCSWC. I've been working as a therapist at that facility since November 2012, so a little over 2 years. I'd like to also add that I was born in Hagerstown. I've lived here all of my life, except for the periods of time that I lived in Baltimore to get my undergraduate degree. I commuted to get a master's degree at the University of Maryland. I worked downtown, right next to the University of Maryland Medical Center. I interned at the medical center. I worked and walked to my car from the hospital past Lexington Market, which is a very violent end of Baltimore City, if any of you are familiar. And I may see patients till 6 o'clock, but I might leave that office next door after 7:30, 8 o'clock, most nights. And you know what? I never once fear for my life. I never once worry that I'm going to get jumped or maimed or whatever because of the quality of the people that are downtown. I really wish I had reached out to Mayor Geispertz. I had to pull it up. It was around March 17th. And I sent him an email just saying, I'd really like to have a casual conversation about Change Health Systems, about what we do, what our vision is as an enterprise, and how I think that the direction that our enterprise would like to go, and why we were motivated to look for a larger space to serve this community. I think that for people that aren't familiar with mental health issues, they have a lot of questions about it. And it's as much as we'd like to think that we have a society that's very understanding and compassionate to people with mental health disabilities, unfortunately, that's not necessarily true. And I would like to just sort of say that I happened to meet the CEO, Mr. Ojo, the owner and CEO of Change Health Systems at the University of Maryland. He and I were in the social work program. And when we introduced ourselves in the class, he told me that he had an outpatient center in Hagerstown since 2009, and I was flabbergasted because I've lived here my whole life and I didn't even know it. I had never heard of it, never even was a blip on my radar. And you know, life took me in the direction of doing outpatient work with patients, and that's how I ended up meeting Mr. Ojo and working at this enterprise. I would like to say that I wish that Mayor Geispertz and I would have been able to meet. Unfortunately, that didn't happen due to various things. But it really troubles me because I feel like, you know, I've read this agenda, and I would agree with you all that there are certainly things, for me, particularly as an invested citizen in this area, that need to improve in downtown. You know, I think that there's a way that we can improve downtown without, you know, eliminating the few resources that aren't relative to just job force and things like that downtown. Because frankly, I think that part of the reason downtown's in the state that it is, I think it'd be a whole lot worse if we didn't have these facilities available to these folks that so desperately need it due to whatever their socioeconomic needs are, whatever their diagnosis is, and things like that. I'm concerned because I feel like, you know, obviously I talk to patients all day long. I have between 40 and 45 patients. I talk to them all day long, 5 days a week. And it has been brought to my attention through conversations with some of my clients that they have, that there may be another agency not far in proximity from our office that does have some frequent problems with behavioral issues with clients. I'd like to say that officially I've been in that office for, like I said, over 2 years, and I can probably count on one hand the number of times that I've personally been present when paramedics were called. We've had people have diabetic seizures. We've had people completely come in and just pass out, and we've had to call 911. But on an ongoing basis, our office is not a nuisance. We have a very strict policy. We have a no-tolerance policy in terms of violence. If there's any kind of violence or intimidation, they're immediately discharged from our office. They do not return. I would also like to say that, you know, obviously you folks know, but for some of you that don't, you know, DJS is 2 stories up from us. Every time a sheriff's car or a police car shows up in front of 44 North Potomac, I can assure you they're not there for Change Health Systems. I think that we actually have a very pleasant population. To the point that was mentioned by the nice lady that was giving the verbatim, you know, there are certainly times where, agreeably, and you know, I've actually passed the mayor several times outside, coming and going, that we do have a population of people that end up kind of coming out and smoking a cigarette and going back in. That was part of the need for us to expand and have more space. We have far more patients than our waiting room will accommodate. Part of the ability to have room to accommodate all these folks would be to to relocate and have a larger waiting room and to have additional rooms available so that, we don't have such overflow out into the main drag. But again, I think part for me that is disheartening about this whole situation, and I do feel like there's some blanketing that's happening with this situation, that maybe some bad apples maybe have spoiled it for everyone. It frustrates me that we're neighbors. The city council, the mayor's office, we're neighbors, and I wish just someone would have just come in, knocked on the door, and come into the desk and say, hey, can you guys have your client smoke out back? It's a nuisance, or hey, there's a problem out front. But to my knowledge, I don't think anyone's ever done that. And anyway, I know my time is up, but I can't tell you how much it pains me as a citizen of this town for so long to think that I have elected officials that are so close-minded, and I hope that you all very seriously consider the long-term effects this could have on the town. Thank you.
Thanks, Jamie. Next person on the list is Danielle Raymond. Danielle?
Hi, good evening, everyone.
Hi.
My name is Danielle Raymond. I'm also next door at 44 North Potomac Street. I'm an employee and therapist at Change Health Systems. I've been there for 3.5 years. And prior to that, I was at Contemporary Therapeutic Services. We were also on the same floor in the same building for about 2 years prior to that. So I've worked in Hagerstown for 5.5 years serving your mental health population. And I want you to know that Change Health, Jamie and I, and other service providers there at Change Health are committed to serving the population here. We've been open since 2009. We are accessible. Most of our patients walk here. We need to be accessible. That's our role. We need to serve our community. And the mental health patients here in Hagerstown downtown, we have an abundance of patients. We have an extended wait list, unfortunately, that makes my blood boil. You all, I know, want your patients or your citizens to be served and treated. We want them treated. That's one of the reasons Jamie touched on, that we need to move. We don't have enough space to meet the demand. If we are able to move, we'll have an extended, larger area for our waiting room, so our patients can be in there in a comfortable environment. They won't be on the street. We'd like to expand our groups so that we can reinforce stress management, reducing anxiety, building stronger citizens, and so they're more productive in the environment, in this society. They'll pay their bills. We want to do employability type groups. We want to reach out and serve in all the ways that we can. The space is limited right now. We can't do that. Also, it's extremely important that we as a community, also with the Affordable Care Act, we need to reduce the ED visits. We need to serve our population in the community. We don't want them to go to Meredith. We had a client today come in a state of crisis. We were able to work her right in with our psychiatrist. She was 2 minutes away from going to the emergency room, and then Meredith would have that burden. The taxpayers have that burden, Medicare costs, Medicaid costs. So we're serving people, we're there. We want to be here. We're committed. We've been here for 5 years. I don't know what's happened. I wish we would have met and talked in a different type of forum. We're right next door. We want to partner. We want to make this work for everyone. We are absolutely dedicated to serving the population here and meeting the needs of the city. Thank you very much.
Thank you. The next person on the list is Andy Levi?
Mayor, we can permit me to defer my comments until later if necessary.
I will permit you that.
I appreciate it.
Next on the list is Bill Wantz.
I would ask the same thing.
Oh, geez, you're asking a lot now. Okay, the next person on the list is Marshall Rock.
Good evening, council members and Mayor Geisperts, Mr. Zimmerman. Thank you for my name is Marshall Rock. I am the executive director of the Washington County Mental Health Authority, which is a core service agency. Each county in the state of Maryland has a core service agency that has the responsibility for planning, administering, funding, and oversight of the providers and consumers in the mental health system. Our office is located at 339 East Antietam Street, and I have been with the Mental Health Authority since 2001 and in the director's position since 2005. In 1999, the Office of the U.S. Surgeon General released its first report on mental health, calling for the full integration of mental health care into the nation's public health system. The Surgeon General's report urged a broad public health approach, including clinical diagnosis and treatment of mental illness, as well as surveillance, research, and promotion of mental health. The report concluded that mental disorders are among the most prevalent and costly conditions in the United States, and that effective treatments can reduce their prevalence and their adverse effects on an individual's quality of life. In years since, mental health promotion, the prevention of mental disorders, and actions to reduce the severity and impact of mental illness have all been increasingly recognized by the public health community as critical to creating positive life quality. Approximately 18%, or 42.5 million adults of American adults 18 years of age or older suffer from a diagnosable mental disorder in any given year. This equates to 1 out of 5 Americans. Look around this room. There are people here who have had some association with mental illness, either personally, through family members, but we all experience some relationship to it. The estimated lifetime prevalence of mental illness among the U.S. adult population is 31.2% for anxiety disorders, 25% for impulse control disorders, 21.4% for mood disorders, and 15% for substance use disorders. Depression is among the leading global causes of life years lived with a disability. These are things that are inherent in our society and need to be addressed through appropriate treatment methodologies. People who have diagnosed disorders can often face problems accessing care appropriate to their mental health needs or mental illness. Access problems can arise from complications due to symptoms of mental illness, either paranoia of riding a bus, inability to leave their home, fear of others, language difficulties, transportation and geographic inaccessibility, limited medical literacy, lack of medical insurance, those kinds of things. These influences on somatic and mental health have been described as social determinants. Social determinants include, but are not limited to, housing status, income, education, stressful circumstances and life events such as trauma, early childhood experiences, social inclusion, stigma and discrimination, either racial, sexual preference, ethnicity, etc., access to resources, stress, physical environment, and institutionalization. Social determinants may have positive or negative consequences. A lack of infrastructure in poor urban neighborhoods often leads to communities that are disenfranchised and social networks that are frayed. This is what people living in downtown Hagerstown are currently struggling with. Removing access to the support services such as outpatient mental health facilities or mental health rehabilitation programs will create barriers that people already living in poverty will not be able to negotiate. The consequence of this could be that people experiencing mental health needs or mental illness may not seek intervention and their lives can deteriorate. This would create additional strain on their physical environment and the other social structures that are there to assist in managing a civil environment for all. It has been stated that there are other zones in the city where ambulatory healthcare businesses can operate. These overwhelming social determinants have placed many individuals in the downtown area due to their housing status and other issues of poverty. By forcing treatment services to locate outside of an individual's accessibility creates barriers for treatment for a real human condition and is unconscionable. Unfortunately, there are also national-level social determinants that create significant impact on lives of residents of smaller towns like Hagerstown. Reducing stigma, developing alliances with existing businesses, and educating the community on the realities of mental illness are good first steps to creating constructive partnerships to strengthen downtown. Creating fear of the disenfranchised members in our community will never revitalize any area of any town. I would like to take this opportunity to invite any city council members or members of city administration to consider participating with other community partners on our law enforcement and mental health task force. This has been in operation since 2012, involves many partners in the community, and the task force's mission is to promote education between Washington County's public safety and mental health systems to cultivate and advance working partnerships for the creation of a safer and a healthier community. Collaborative partnerships around clear goals can create positive outcomes for all involved. Thank you for this opportunity.
Thank you. Next on the list is Raj Patel.
Mayor, I'd like to withdraw my testimony.
Okay. Next on the list would be Connie Pauley.
He's down a little bit. He's kind of tall. Hi, my name is Connie Pauley. My address is 11944 Comanche Drive in Smithsburg. I am the Washington County President of NAMI, that is the National Alliance on Mental Illness. We're a state organization as well as a national organization. I'm going to give you a little test here real quick, and I'm going to see if you recognize some of these names from the arts and entertainment industry. Charles Dickens, Hans Christian Andersen, Ernest Hemingway, Beethoven, Emily Dickinson, Mark Twain, Michelangelo, Carrie Fisher, Patty Duke, Ted Turner, Drew Carey, Richard Dreyfuss, and Audrey Hepburn. And then we're going to add a few world leaders and politicians. Winston Churchill, Abe Lincoln, George Patton, Barbara Bush, Patrick Kennedy. Now, what do you think all these people have in common? They all had a mental illness. Do you know what the face of mental illness looks like? Some of you have seen some of those faces here today from these brave folks that have talked to you. And some of the other folks are maybe your husband, your wife, your children, your family, your neighbors, your friends, your lawyer, your minister, your doctor, your politician. People that you see every day as you go about your business. They're a vital part of your community. It seems that I've heard a lot about your concerns of the youth in the community. That is important because the onset of chronic mental illness begins at age 14. Suicide is the third leading cause of death in teenagers. Sadly, our families in this community have dealt with that. 60% of adults and half of youth aged 15 to 24 receive no mental health services, sometimes for decades. We should applaud our community of mental health providers that have stepped up to the plate so our citizens, both young and adults, will not be a negative statistic. A mental health facility downtown where some of these youths are already struggling with mental illness seems like a responsible move on the city's part. If our courts and our schools create a need for referrals, how important is it for the city to support our professionals? Your vote against the moratorium is a vote for the well-being and the equality for all citizens in downtown and the Hagerstown area. A vote against, I'm sorry. A vote against the moratorium is a vote for the well-being and equality for all citizens in the downtown and Hagerstown area. A vote for the moratorium would be a vote against treatment and an insult to all those that seek treatment as they cope daily with mental illness. And I do have a handout for everyone. I would like to give that to each one because it's a brochure from our national organization called Mental Illness, an illness like any other. And I thank you for your time.
Thank you, Connie. The next person on the list is Sam Rogers. Sam?
Good evening. I'm Reverend Sam Rogers, and I live at Walnut Towers, 12 South Walnut Street. As a minister, a retired mental health and addictions counselor, and a person living with mental illness, I'm very sensitive to the issue before us. I was only recently made aware of the clinic, as some other people have said, but when I heard of it, I offered to put in my 2 cents. I was somewhat surprised about the proposed moratorium because I was told, I think, that that the clinic was already, the move was already approved. And so I was surprised that someone was opposing it and trying to put a moratorium on it. I understand and I appreciate the revitalization efforts. I learned about that and wanted to become somewhat involved when I took the city college program a few months ago, graduated from it. And I do applaud that effort. I think that I think we need that in our town. But this emergency moratorium on a specific clientele concerns me greatly, even in light of the city's interest in downtown revitalization. I would certainly like to know more about the reported alleged complaints. Some clientele, quote, some clientele at the health facilities, more than one, intimidate and discourage people from coming downtown. Do we have specific corroborated examples of the clients, of the consumers are doing these things? Do we know? Can you give me some examples of what they are? If not, why not work with the people? It's been said before, why not work between the businesses, the people in the businesses, and those folks who are dealing with these clients? In any case, the services provided by the health clinic in question seem to me a kind of ministry to a part of the community considered undesirable, that apparently don't fit the image of whom we would like to attract downtown. But they are already down here, utilizing other services, shopping at downtown stores, going to the library. Many of them live near the square. We've already heard about some of those folks, from some of those folks. They are part of the community. These folks are clearly in need of this service, or this clinic would not need to expand. Other providers of these services are located outside the city, which has already been said, making it difficult for them to get to. And as was said, I think there were services similar to this at the hospital, which is now gone, and so there are no such services at that facility. As a student of the Bible and a Christian, I see a mandate from Jesus, exemplified by his own life, to serve and minister to those considered outsiders who don't fit our image of socially acceptable citizens. In this community, it's my impression that a majority of us call ourselves Christian. So I appeal to this population to include in the planning those who don't seem to belong in our vision of a revitalized downtown. Perhaps inviting representatives from this population and the clinic to help us find ways to be a city welcoming to all citizens. I'm not sure how we might do that, but I would be willing to help if I could. For now, I particularly urge the council not to shut out those who are willing to help those individuals in need of their services to become contributing members of our community. Perhaps our letting them know they are welcome and truly accepted as worthwhile citizens and human beings may help them discover and offer some insight, some wisdom, some treasures that will benefit us all. Their contributions to the planning and beyond might help to revitalize downtown, which is their home. I would rather us put a moratorium on discrimination if it had anything to do with it. Thank you.
Thanks, Sam. The next person on the list is Janet Bartels.
Thank you very much. I apologize if my comments aren't as well-formed as they could be. I thought I was going to be in an Earth Day activity with neighborhood kids, and it got changed. So I'm able to be here and speak against this moratorium on. I live in a downtown neighborhood. I have been active in Neighborhoods First for the last 9 years. I have been also use the downtown. I have tickets to the Symphony, the Washington County Playhouse. I attend all the events. I'm a frequent user of the library. And this moratorium is just an attempt to again blame the victims of what has happened to our economy and what has happened to the city. And its unfair relationships with the economic structures, be they the county and the city and the school district. That the poorest of the people in Washington County a higher percentage live in Hagerstown, many of them in Center City. And many of them are my neighbors. And I'll tell you, my neighbor who lives on Social Security disability and has $15 of food stamps a month is a victim of what's going on here. She is not the cause of it. Our neighborhood is in decline. Very much so. My evaluation on my house is 30 to 40% lower than it was when I purchased it. There's no way that we're going to be able, people in my neighborhood, which this is what has happened, are going to be able to make up for what has happened. And I think if we have the highest percentage of poor in Center City, why aren't we building up instead of trying to cast aside the services that they so desperately need? Why aren't we trying to build up our social infrastructure here? Why aren't we getting that extra money that comes because we are below or at 75% of the income tax levels for Maryland? Why isn't that couple $1 million coming directly to Hagerstown itself to provide the extra services that we need to provide for making that differential exist? Why aren't we we've doubled the size of the library. Why aren't we insisting that the county give money to service the neighborhood, to do the staffing that's necessary to provide the service for our most vulnerable children? Why aren't we insisting that the library do something with its property, or at least beautify it in some way, cordon it off so that we're not having hate graffiti that will just paint over, but we won't deal with what's going on in Hagerstown right now? And it's pretty scary. And when you use some of these code words here, to me, they're very frightening. They're very frightening. And when we're saying we've got to do more, because these people are making it uncomfortable for people to come downtown. I have not been made to feel uncomfortable coming downtown from anybody there. In fact, I've had help with things if somebody sees me needing the door opened or whatever. It's the wrong way to go. You need to build up the neighborhoods first, not take it down. You need to build up code compliance and the inspections of the rental units. We have people just walking away from the houses in our block. So we need to all work together and bring everybody to the table. My neighborhood was very underrepresented with urban partners. So I say, let's all sit down at the table and do something. All work together to really revitalize Hagerstown, not throw people out who need it the most, and it services the most.
Thanks, Janet. All right, who wants to go first, Mr. Wantz or Mr. Levy? I'll leave it up to you.
I think I pulled the short stick here, so I'll come here first.
If you want to, you can just pull to the end of the table here.
Okay, I appreciate it. My name's Andy Levy. I'm a lawyer in private practice in Baltimore, Maryland at the law firm of Brown, Goldstein, and Levy. One of the things that my law firm is known for is our practice in enforcing federal civil rights statutes, including the Americans with Disabilities Act and the Fair Housing Act. And Change Health has asked me to consult with it, and they asked me to come here tonight to address the council. And I do so not in an adversarial way and not in any way intending it to be threatening in any respect. But I think it is important that whatever the council chooses to do, that they do it with a full understanding of the facts and the law that applies when government and municipalities act in these areas. And so I am here on behalf of a private client, and you certainly are welcome to take my comments with however many grains of salt you choose. But I hope you will take what I say very seriously. The Americans with Disabilities Act and the Fair Housing Act protect what are various individuals. One can be a protected class under these statutes because of one's color, one's ethnicity, one's gender, one's religion, or one's disability. And the reason that is relevant here is that Change Health's patients who have behavioral health issues, mental health issues, are considered disabled under both the ADA and the Fair Housing Act, and they are subject to the protections of both of those statutes. They are very powerful statutes. When they're violated, they permit damages, and the losing defendant has to pay the plaintiff's attorney's fees. It is illegal under the Act, I submit, to make statements that the record is already full of based on tapes that I have reviewed from previous work sessions, the staff memorandum, which characterizes, though not by name, though it's obvious what is being referred to, Change Health's patients as being undesirable, as being not the sort of element that one wants in the downtown, as being an element that drives others away from the downtown, and therefore that legislation is needed in order to move them somewhere else from the downtown. If I were to file a lawsuit and I were able to prove that that was the intent, that that was what we lawyers call the animus involved, that would make out a prima facie case under the Americans with Disabilities Act and the Fair Housing Act. One member of the council even said in public session that this council member would like this clientele to be driven out of the entire Hagerstown city limits. It is offensive for the reasons that the speakers before me very eloquently stated, but it is also illegal. And if the council acts on that intent, the council has violated those federal statutes. There is a town in southern Maryland, Leonardtown, which attempted to drive a very similar kind of business from Change Health, a business called Pathways, out of its downtown. That case ultimately went to trial. There was a $500,000 verdict against the town, many more hundreds of thousands of dollars of liability and attorney's fees as a result of what I submit, with all due respect to this body, was a record very similar to what is being assembled here. So I urge the council to take a breath, take a step backwards, consider what you are being asked to do, and tread very carefully in this area. The last thing I want to leave you with, and I hope and I'm sure you understand how difficult it can be. I mean, I use words for a living. This is what I do. But for the people who spoke before me, how difficult it is for them to get up in public and say that they have mental health issues and how important these services are to them. This is such a stigmatized status, and it is for that reason that these laws protect them. Among the many ironies here was in the staff memo, in the just attempting to justify this action, was expressing concern about, apparently there's a school for the arts that is very near where Change Health's office are, and that this moratorium is necessary to protect them. Change Health has a contract with the Washington County Public Schools. Among their patients are the students and their families from this school. If you drive Change Health out of the downtown, all you're doing is driving the provider of services out. You're not driving out the people who depend on those services. These individuals are not bussed in from some different time zone. These are your constituents. These are your residents. Change Health did not attract them here. It is their presence here and their need for these services that brought Change Health here. And I just, with all due respect to the difficult job that this council does, I urge you not to let the staff lead you down the primrose path of an action which I respectfully submit you will eventually regret. Thank you.
Mr. Levy. Mr. Wantz?
Good evening. I think I know most of you, know all of you. My name's William C. Wantz. I'm an attorney here in Hagerstown. My office is at 123 West Washington Street. I own the property, and some of you will see me in nicer weather walking back and forth to work. I probably walk the streets of the downtown as much as any of my colleagues. I, like Mr. Levy, am not here to be critical. I'm here to offer you a different perspective. And I'm here to speak as a lawyer. I was walking through downtown Hagerstown a few years after I was admitted to the practice of law, and Lee Downey stopped me on the street and asked me if I'd like to serve on a commission that he had nominated me for of the health department. Thank you. I thought I was going to be on some board reviewing septic systems. Instead, I found myself on the Mental Health Advisory Committee, which I went on to chair for 12 years. Mr. Downey didn't know at the time that I had a family member with mental illness and that this was a good position for me to be in. Those of you who know my background as a volunteer for the city know that I have some expertise in zoning, and I've studied moratoria. In fact, back in April of 2001, when this Pathways case came out, I was one of the first to get a copy of the slip opinion from the court because I was serving as chairman of the zoning board, and I had to know these laws in order to adequately perform the services assigned to the Board of Appeals in zoning matters. Several months ago, I met Israel Ojo and his colleagues in my capacity as the attorney for the sellers of the property downtown, the old former Bickles building, and then later Bickles Ski Shop. I met them at the closing. Some of you haven't had the opportunity to meet with them. They're nice folks. They're dedicated mental health professionals. They're already here. As my colleague, Mr. Levy, said, they're already serving, I believe, for the third year under an MOU with the Washington County Public Schools. They're trying to help meet the demand. They have a waiting list. They've outgrown their facilities. They invested over $250,000 in purchasing a property and expect to invest a lot more. You would think they fit the profile of those types of downtown investors willing to buy properties, convert them to offices, rehabilitate them, and pay taxes. They are not a charitable organization. They are a for-profit tax-paying enterprise. They are experts in this field. Somewhere along the line, the city staff made a recommendation to you to consider this moratorium. Mr. Levy's given you abundant reasons in this rare instance not to follow the advice of your staff. And I would concur in that recommendation. I would urge caution on taking this approach, not only because of the legal implications and consequences of which I'm far too familiar, but because this sends the wrong message to investors. It sends the wrong message to participants in healthcare programs. It sends the wrong message to people beyond our community about what we are and who we are and how we treat ourselves, how we treat our neighbors, our coworkers, our family members. Mental illness strikes young, old, rich, poor, brother, sister, parent, child, grandparent. It can strike in adolescence, it can strike in adulthood, it can strike after a traumatic, life-changing event, it can strike in old age. We need these providers, and we need them where they can best serve the community. It seems to me that in this consideration, if I could urge anything, I would say read the decision in Pathways Psychological versus Town of Leonardtown. I've known in my tenure on the Maryland Municipal League's Legislative Committee for 12 years in the past, former elected officials of Leonardtown who were not involved in this. I'm familiar with Leonardtown. It's a nice little town down in St. Mary's County. My concern is I'm not going to tell you what's in this case. It's sort of like telling you how the story ends. But when you read this case, and I don't think any of you should responsibly vote for this moratorium for or against without first reading it from beginning to end, you'll see a lot of ourselves in this. You'll see a lot of this issue in this. You'll see a lot of policy in this. And I think you'll find that you will align after reading this case with the policies embraced by the federal court. Thank you.
Thank you.
I have a public information act.
I think the clerk will take that. Well, that concludes the public hearing portion. I'm sorry, would you like to make a statement, sir? Yeah, I'd just like to say. Please come up and state your name and address for the record, please.
I don't have any notes. I wasn't really
That's okay.
speak, but a neighbor of mine kind of got me. Anyway, I keep hearing...
State your name and address for the record,
Neil
please.
Silverman, 115 South Mulberry Street.
Thank you.
I bought a home, single standing home in Hagerstown, and about 3 years ago, And one of the deciding factors that made me buy my home, purchase it, take out a bank loan, pay it for the next 30 years, was the fact that I liked the idea of being able to walk to the post office, being able to catch a bus and go to Valley Mall. I liked the idea of city living. I liked the idea that there was a change healthcare system within walking distance. The main reason I bought my house was when I bought my home, I live on Mulberry Street, which was 1 block away from where the old hospital used to be. One of the reasons I bought my home was because I liked the idea of there being a hospital there. So that was a good reason why I bought my house, because the old hospital was there. After I bought it, I started hearing rumors about they're going to tear the hospital down, they're going to tear the hospital down. And they did. And they tore it down, and now I'm ready to leave Hagerstown. I'm ready to walk away, let the bank have the house, let the roof collapse on itself. And the reason I'm ready to walk away isn't because of Change Healthcare or the people downtown. The reason I'm ready to leave is because ever since the hospital left, it's like my whole Elizabethtown is just in a giant sinkhole. And I'm watching it sink so fast that I'm ready to leave, not because of Change Healthcare. I'm ready to leave because there is so much heroin, so much cocaine being sold on every corner I walk that I'm ready to get out of here. I got a 12-year-old son I'm trying to raise. And I used to tell him, oh, you can go ride your bike, you can ride down to the end of the block, down to that end of the block. Now, I'm scared to let him go outside. When I tell you they're selling more heroin on the corner of Antietam and Mulberry Street than Sheets is selling coffee, I'm not exaggerating. That's why I want to leave, not because of Change Healthcare. I'm glad to know there's a Change Healthcare in town. Hell, I'm on the verge of needing mental health. That's all I got to say. I'm ready to get out of here. I moved to Hagerstown with the best of intentions. I planted flowers. I planted flowers in my tree pit. I fixed it up. I was looking forward to living there. When I tore the hospital down, like I said, my whole neighborhood is just sinking. And it's sinking so fast. You got drug dealers coming in from New York, Philadelphia. They're pitching heroin on they're selling it in Bixler Alley. They're selling it in the other alley. They're selling more heroin than Coke than Sheets sells coffee. And I'm not kidding. And that's why I'm ready. You know what? I'm ready to get out of here. I'm ready to move to Marion, Pennsylvania. I'm ready to just walk out of Hagerstown. And I came here with the best intentions, but I don't see, I'm disgusted.
Thank you, Neil. Anyone else wish to speak that didn't sign up tonight? We will keep the record open for 10 days. If you want to share correspondence, please direct it to the city clerk, and she'll make sure we get it in a timely manner. We will also, because there were two advertisements with two for different times for the hearing tonight, I understand some people may think that the hearing starts at 7, so if somebody arrives at that time and wishes to speak, we will maintain our special session as we move through the work session items on our agenda and allow folks to speak if they come after 7 o'clock. So at this point, we will shift direction in our agenda and move into work session items, the first item of which is a proclamation for Autism Awareness Month.
Send it to the city clerk for the record. She'll put it in the, say it's for the record.
right, let's see. And who do we have here accepting the proclamation this evening? Mike. My mic. Sorry. How are you? Nice to see you. And this is a proclamation for Autism Awareness Month, April 2014. Whereas autism, the fastest growing developmental disability in the United States, affecting more than 3 million people, is an urgent public health crisis that demands a national response. And whereas autism is the result of a neurological disorder that affects the normal functioning of the brain and can affect anyone regardless of race, ethnicity, gender, or socioeconomic background, and whereas symptoms and characteristics of autism may present themselves in a variety of combinations that can result in significant lifelong impairment of an individual's ability to learn, develop healthy interactive behaviors, and to understand verbal as well as nonverbal communication. And whereas the effort to address autism continues, doctors, therapists, and educators can help persons with autism overcome or adjust to its challenges and provide early, accurate diagnosis and the resulting appropriate education, intervention, and therapy that are vital to future growth and development. And whereas it is important that persons living with autism have access to lifelong care and services needed to pursue the full measure of personal happiness and achieve their greatest potential, now therefore I, David Geisberts, the mayor of the city of Hagerstown, hereby proclaim April 2014 as Autism Awareness Month in Hagerstown, Maryland, and commend its observance to all citizens. And Mike, do you want to say a few words?
Just as a parent of someone who's under the spectrum, I thank the council and the mayor for making this not only an awareness issue, but also something that's hopefully proactive in the future to deal with things that you may not understand that they deal with, whether it be social activities, just being accepted in the community and having an outlet where they're recognized and accepted as members of the community. So I thank them for being proactive, and hopefully this isn't the end of the story. Thank you.
And you use the word spectrum, and that's important because there's a whole range and variety of aspects to autism. So I appreciate you being here on behalf of your family and all the other families who deal with this on a daily basis. Thank you. Oh, picture? Sure. All right, thanks. Sure. Yeah, I think we were talking about amending our work session agenda here to compensate for some of the timing issues. Is everybody okay with moving item 4 from the agenda? I know Lou's not here, but the budget, I know we were talking earlier. Lou approves. Is everyone okay with that? Kristen, you're okay with? We have a work session solely devoted to the budget from 4 to 6 next Tuesday. Yeah. Okay, so we'll strike that item. I think if we do that, we should be able to complete everything else in a timely way. Let's go ahead and look over the preliminary agenda. Next week, Councilmember Metzner has the invocation. We'll try to remember to remind him when he comes back. We have the minutes. Under the consent agenda, we have our DCED items, the approval of a permit and open container exemption for USMH graduation May 20th. There is the permit for the Blues Prelude, Blues Fest, and the Blues Club, and also the application for open container for the Maryland Theater Wind Down. And I know there are some representatives here from those various organizations, so if there are any questions or if you'd like to have those folks come up. Maybe I'll just invite you to come up and talk about what's going on anyway, so folks can know.
Protest, but we did it anyhow.
We have Aaron Harmon from from University for the graduation. Carl Disk from Blues Fest, which I know Rain Insurance is on a little bit later. Carl. And then
Who's this guy?
yes. Don't recognize chairs. And we have Jessica Green and Melissa Fountain from Wind Down. Go ahead,
Sure.
Carl. I'll sit back here. Aaron, do you want to start out?
Sure. The USMH graduation celebration is on May 20th. We have it every year in the courtyard or in the University Plaza. We have about 300 people Lighters caters it, and they do have a bar, and they sell beer and wine. It's always a very respectful activity.
Sorry.
We've never had any problems, but because it's a celebration, we'd like to be able to sell beer and wine.
It is a classy event. I was there last year. Any questions for Ms. Harmon? Thank you. And then we got the Blues Fest coming up. Tell us more about that, Carl.
Yeah, well, I've got some things to hand out to you here that hopefully you'll get as excited as
Mark your calendars now,
as
right?
we are. Yeah, the end of May is upon us in a month or so, and so citizens will be hearing a lot more about Blues Fest as we really kick it into high gear in terms of our marketing and promotions of this national event, really. But I just want to really say thank you to the city administrator, to city staff, to this mayor and council and those past. We're celebrating the 19th Western Maryland Blues Fest this May 29 through June 1. But it's really been 20 years for me, and for 20 years ago this past February when I got to be introduced to Karen Giffen and to work closely with her and the city and all the years since. And I really want to thank not only this body, but also the community, because the community has really embraced this event. It really is a signature event, an event that brings a lot of pride to members of our community to say that this was a locally produced thing. It certainly was an unlikely suggestion and an unlikely thing to succeed, I think, because Hagerstown had no historic connection to blues music, and I think that just shows it doesn't matter. It is in our DNA as Americans, I think. And so we've really done good things together. We've grown this event together. We have a great business community that has sponsored and allowed us to keep ticket prices low. So I hope people will go to our website, our newly redesigned website. We want to thank the people at Icon Graphics. With the increasing use of people using their cell phones or their tablets or any other type of mobile device in addition to a desktop, this new website at blues-fest.org is amazing. And if you don't get excited about this 4-day event that includes free events as well as ticketed paid admission events right in your backyard, produced and underwritten by your city and your city businesses, then I don't know what could excite you locally, because it really is a wonderful thing, and it's been my pleasure to serve as the founder and event chair for all these years. And we really have so many people that pull together, in addition to city staff, that make this come alive every year, and that help produce it, including volunteers, over, I think, 200, is it? On the day of the event, and we certainly have a really good committee of volunteers, again, who just give of their time, and some people give of their time and their money to put this on just for the good of this community. So thank you so much.
Well, I know your QR code works because I just did it on my cell phone, and the website looks really good. So congratulations.
Thank you.
And any questions about the Blues Fest?
We have rate insurance a little later on.
Okay.
I did want, if you'll let me do a little plug here, we do try to recognize a very diverse programming in our Blues Fest. And that's diverse as to gender, race, style of blues music, old, young, everything that you could have. And of course, we also spotlight things for our youth. City Credit Services does a great job in underwriting our Sunday this year children's area. And we're going to have an internationally known guitarist, Ronnie Earl, coming back. He's been nominated and successfully been awarded Guitarist of the Year many years, and he's up for that again in the Blues Music Awards. But we're also proud to announce that a few years ago I made an outreach to an exciting British blues artist who had never come to America, and he's having his first U.S. tour this summer, and guess what city and what event are part of that tour. So people in America who have never seen Ian Segal and are interested in what the strange connection almost between English guitarists and American blues music that has been so successful. He is yet another of this variety, and he's coming here to Hagerstown to be with us, and we are just so excited about that.
Thank you. Very exciting.
Thanks, Carl.
And,
We're going to do rain insurance in a couple minutes.
Okay, sure.
or you can talk about rain insurance now. Yeah, yeah.
Makes sense. Makes sense.
Anyone have questions about the rain insurance?
Okay.
9,000?
Just one note on Blues Fest.
How often has the rain insurance been used in the past?
Yeah, we've hit about 3 or 4 times, yeah.
Yeah.
What was the premium, 9,000?
Let me get my note. The cost of it?
Yeah.
9,600.
Yeah, 9,000. So if you hit once or twice, you paid for it,
Right.
Well, we've had to fight for it a few times too, but we got it. And just a note on the festival itself, this week we did hit fundraising goal.
Yeah.
And the
Wow.
fundraising goal
Thank you.
was 96,000, and I believe we're at about 98,000
And
right
I know
now.
you guys busted that last year, didn't you?
We did,
Yeah.
and,
Went over
and
1,000,
This is the
100,000.
earliest I think we've ever
yeah,
received a goal.
definitely. And then the
you have any
in-kind-
left over?
It's the community.
You have any left over for
No, and the in-kind's about 115,000 that we raise as well. So thanks to
Fantastic.
everybody for keeping this going for 19 years, because I was 15 when it started.
Thank you. Keep telling yourself that.
Lou and I celebrated together.
Okay.
And then the new wind down. Thank you.
Yeah.
Okay.
Thank you.
And then wind down, and we have Jessica Green and Melissa Fountain, and this is a different layout, and we have worked with police. I don't know. Joey's here. We've also worked with the fire marshal. We've worked with logistics staff to create this. We've gone to the liquor board a few times. The reason they did it, and I'll let them explain that, is to enhance the event, make it larger. And we've really worked hard to have that. The map is in your packet, so if you have any questions on that.
Can you just describe what it's going to look like, how it'll be different?
We're hoping to have more of a street festival atmosphere instead of people being confined to the theater courtyard. We've also, in addition to the other people that Karen mentioned, we've also worked with the restaurants on that block to be sure that they're supportive of this type of event. But other than that, it's really just an expanded area. Based on the theme, we're hoping to have a few vendors at each event. Obviously, the band, some tables and chairs, a kids area.
So the demographic has changed too, and
Right.
so we're opening this up as more of a community event where families can be involved and bring their children down. Bridge of Life is getting involved with a movie for kids. So there's just more to see and do as a family.
And really, in years past, it was a wonderful event for the theater as a fundraiser, but as it progressed, it just became a huge undertaking for the theater to take on every Friday throughout the entire summer when we had a whole busy rest of the year. So Greater Hagerstown approached us. They've been wonderful to work with. We've got What's Next, who is great at promoting events, we know. So we're really looking to come out on May 9th with a big bang and have all of our ducks in a row.
And it is more of a monthly event, and they have a theme for each of the months. I think the other thing is that they're working with a whole group, and they have about 18 to 20,000 just in sponsorship, so you see a commitment from there. So they really wanted to enhance event that was happening, not only for the theater, but for the community as a whole. So we're trying to do it as respectfully and safely as we can.
And with 4 themed events, it allows us to concentrate a little more and put more into each individual event.
Make each event more quality.
Well, one's May 9th, and then July is...
11th.
July 11th. The bike night is June
Yeah.
13th, so we wanted to coordinate with that, so. And then August 22nd, and then September 26th is Thunder in the Square, so they're going to be working with that.
Partner with that.
Isn't August 22nd the weekend of August Overfest?
It is, but August-Toberfest is the
Starts.
23rd and 24th,
Yeah.
so
Right,
this
right.
is kind of the
It's the same
start.
weekend, is my point.
Try to tie in with that crowd.
Okay.
Yes.
So you're going to do, okay.
Yeah, the theater works with the bike
For
races
the
each year.
bike race, the theater hosts the VIP area in our courtyard.
And then we'll be coming back next week, or next month, because we'll be working on bike night with the theater as well, so.
Motorcycle night.
So
You're
we
right.
have, we have the bicycles, the motorcycles, and we have the cars, so I think we've got the wheels covered here in Hub City.
Is the suggested time frame for street closure, is that consistent with the past? Wind down
Yeah.
Friday?
Yes.
We just
We-
wait for Barbara Ingram to.
So we
Get
close
out.
the street at
Mhm.
5
Yes.
o'clock?
5 o'clock.
Yes. You're ending a little earlier, correct?
6 to 9.
6 to 9.
That's what it's been, yeah.
But pedestrians will still be able to traverse the area,
Yes.
regardless of the activities occurring?
Correct.
And it's a free event to just come in and peruse.
Any other questions for these folks?
Thank you.
Okay, thank you
Thank
so
you.
much. Also on the consent agenda are 2 items for the Department of Utilities, wastewater manhole risers and integrated technology system for wastewater. Any questions on those? Hearing none. Under new business, we are introducing an ordinance repealing of Chapter 70 cable television open video systems. Any questions on that one? How about the temporary moratorium on ambulatory healthcare services? I think we're very familiar with that at this point. The item C is the third amendment to the lease at Municipal Stadium. We were successful in getting the Suns to agree to $20,000 more thanks to Mr. Brubaker's suggestion. And any questions on that? Everyone had a chance to read the lease and okay. Moving on. There is the right of entry for the EPA that we're going to talk about in just a little bit. The residential lease agreements for apartments 2, 3, and 4 at 38 North Potomac, the Artist Lofts. Any questions on those for staff?
I have 2 questions.
Sure.
Let me get back to it here. There we go. The first question is, I guess, fairly simple. These are all of the apartments, right?
Just
all
fills it
of them
out.
are all of them are rented out now.
Yep, correct.
The whole building.
Correct.
And it says here, maybe I didn't read it closely enough, but the rent amount is for the year. So I'm assuming that means the lease term is simply for 1 year.
They are for 1 year.
Okay.
Yep.
And while it includes requirements for the leasee to participate in the you know, I guess the public art.
Yeah, the gallery downstairs.
Gallery exhibit. The assumption that we'll make here is that all 4 individuals that you have leased to are in that profession.
Yes, in some
Okay.
manner, correct. We're, you know, not specific on medium or how they are, but that they are involved in
Okay.
creating art.
How, if you don't mind me asking, how do you verify that in sort of the selection process?
There was an interview, so applications came in, there was an interview process that happened where we gave each applicant an opportunity to explain their passion for art and what they did, show us what kind of art they created. And
so all 4 of these individuals work in the art profession.
they have a passion for it. Sometimes they are students of art, and so they're students at the same time that they are creating art on the otherwise. One applicant, I believe, does have another full-time job, but he's
Okay.
you know, he's passionate about his art and looking to make that his full-time profession.
So they presented like a portfolio.
They
to
present a
you.
portfolio where
Okay.
appropriate. Yep.
And you had members of the community on that committee as well.
Yep, members of the community.
Arts
members.
Council.
Mm-hmm. Mm-hmm. They're Valley Arts Association, Shepherd University.
Okay.
Yeah.
Any other questions on the leases? Item H is a resolution, a user agreement for the Washington County Seniors Softball League. Any questions on that?
Yeah.
Can I go back for a second? I'm
Sure.
sorry.
Go ahead.
The year thing, and I think the incubator question at the HCC sort of triggered my mind on this week when I was thinking about it. You know, these are pretty favorable rents for a fairly nominal exchange of services at a fairly good expense to the city to get this good program up and running. Will there be a process at which the staff expects turnover? In other words, let's say I have a passion for arts, and 15 years later I'm still here because I'm getting rented a pretty sweet place for $500 a month, and I don't want to put it that way, but you know,
If they're not,
I'm trying to figure out sort of if you're going to put in place mechanisms for turnover,
the
if you
exit
will,
strategy,
and getting that continuum of fresh energy.
they'll be evaluated on an annual basis. If they're not participating, if they're not contributing, then they will be. That will
their lease won't be
they'll-
renewed.
And I understand this is sort of
Yeah.
a new thing.
It is.
I just, I would think after 5 years ago, okay, it might be time for,
Right.
apartment B to get some new blood in.
Right. And no,
I
you're
don't
right.
know.
And those those are all
Okay.
be kept in mind.
All
Sure.
right.
Yeah.
Thanks. Sorry, Marty.
Thank you. Softball, Marty, did you have a
Yeah,
question?
I just, it's the Washington County Senior League, and I'm sure it's a good outfit and all that. Just wondering anybody has an idea to what extent city residents, city teams are part of this, part of the league?
I don't know the answer to that question. I can find out for you before next week, what the percentage would be.
Yeah, I mean, not exact, but ballpark, order of magnitude. Sort of curious. And second of all, how soon do you know when it's available for other events, other activities?
They generally give us their schedule like in this time of year, and they have their league planned out, and then we can start filling in the holes after that. They're pretty good to work with.
What extent of the time do they use up?
Not as much as like the softball fields at the fairgrounds. This is maybe 2 months, 3 months, something like that. And then the rest of the time, it's usually available.
Okay, and it's working out okay?
Yes, very much so.
Okay, I just appreciate a ballpark on it.
I will get that.
The park, city park?
Yeah, it's up there behind.
No, a city park.
Yeah.
City park.
Yeah, it's
I
up
thought that's
behind.
what he's talking about, because I know at the fairgrounds you can't, you don't use those
No,
fields
no,
at all.
We're talking city park.
I
up there
know,
in
I
the-
know. When you said senior, then it clicked, okay, because I just know that those fields over at the city, over
We're
at
eligible.
fairground, forget it.
As long as it doesn't interfere with
The next
sword
item,
fighting.
any other questions on softball?
Sword fighting over there.
Next item is the license agreement with Amanda Miller for the fishing lesson sculpture at City Park. Any questions on that? And by the way, there's a raffle going on for a desktop version of the sculpture that is being planned, and I have raffle tickets if anybody would like them. Please see me after the meeting. Any questions on that?
You're going
Thank
to
you.
float me alone?
I'll buy you a ticket, Penny. The next one is the acceptance of a grant, Chesapeake and Atlantic Coastal Bays Trust Fund. Any questions on that?
$500,000, so I think we're going to make a big dent in stormwater, is that it?
Yeah, this is
Or is it?
Yeah, it's going to help. I don't know if I'd call it a big dent, given the amount of money that we may have to spend on stormwater, but it's a good start.
Well, I just saying for 500,000, I mean, I know this stuff is expensive, but I would think that these would be fairly useful facilities.
They are. As you remember, we commissioned a study of retrofit stormwater
I-
sites, and these
I
were
do.
two of the highest ranking
Yeah,
sites.
down that low, yeah.
Two of the more cost-effective sites. So
We're
from that
putting some of
standpoint,
our own money forward too, as well, right?
this grant is set up as a $500,000 grant from basically DNR with a $100,000 match from the city.
All right.
I have
Any
a
other-
question.
Good.
One of these sites is obviously the site next to the Light Department Central Maintenance Garage. Is the goal, because I imagine that's the more expensive of the two, maybe I'm wrong, but is the goal of that retrofit to account for simply the current stormwater management related deficiencies in that area served right now, or is it planned to account for additional development within that area of either, demolished or other impervious surface?
At this point, the project there adjacent to CMG and beside Hager Park is actually the smaller of these two projects, and by far the least expensive of the two projects
Okay.
that we're going to construct. It's very small scale. It's basically taking existing drainage channels and reconfiguring them to provide some treatment. And it's mainly going to treat the runoff that comes off of CMG's site and the light department site. It's not really designed to capture a bigger area. There was a second project right there with this at Hager Park that would have been much more extensive and would have provided treatment for a larger area, but that's not part of what we submitted in the grant request. So I'd say this particular project is probably not well suited for future development, but we have another project, potential project conceptually designed that could start to provide that there.
Any other questions on that? Next item is the Sinagro Wastewater Treatment Plant Sludge Storage Tank and Sludge Thickening Project. Sounds like a lot of fun there. And that's also going to be discussed later tonight. The approval of the MOU for the Hagerstown Police Department and CASA. Any questions on that? And of course, we talked about the rain insurance for the Western Maryland Blues Fest. So that's our preliminary agenda. Oh, I don't have, yes, item L, approval of police housing incentives. I skipped that. Does anyone, and we're going to talk about something related to that.
Well, that's the general city housing incentives for downtown, but the police housing incentives were the ones we talked about a couple weeks ago.
Right.
So we just
Any questions on any of the preliminary agenda items? Okay. With that, we'll go on to our next item, which is the Central Chemical Groundwater Monitoring Right of Entry Agreement. Thanks for your patience.
Yes, I was going to say. Thank you for saying.
It's quite interesting. What you guys do.
About a month ago, staff made a presentation to council about the ongoing monitoring and remediation efforts at the former Central Chemical site. And we presented a request from the Environmental Protection Agency to install some tracers or detectors at surface water locations around the city, and for them to do dye testing, trace the path of dye from the Central Chemical site to these various monitoring locations. And the council members had several questions which I wasn't fully able to answer, not being as well versed on the program itself. But the two main questions seem to be the dye that is going to be used for this test is a very bright fluorescent green, and I know that there were some concerns raised about that dye showing up in City Park Lake or in people's basements or sump pumps and things. And the other question, or
but that's the point, right? We want to know if it shows up in there.
It is. I think it was just the how bright the dye looked in the photograph that was in the packet that caused some concern.
Non-toxic.
I will let I'll just talk to that. The second issue, or the second question that came up, is these detectors are being placed in springs or surface water sources around the city. But a lot of the previous testing at the Central Chemical site has been deeper in the ground. It's been well testing at various depths below the surface. And so there was some question, why are we testing surface water sources if we think the contamination is way down in the ground? So in response to those questions, asked Mr. Robert Wallace to appear here tonight and give a short presentation. He is the EPA's remedial project manager for the Central Chemical site, has a long history with the site, and hopefully he'll be able to answer those specific questions and then any other questions you have regarding Central Chemical. So, Mr. Wallace.
Thanks, Jim.
Thanks for
Mr. Mayor, members of the council, thank you for giving me the opportunity to make this presentation.
As Jim said, I've been working on this site for a long time. I'm familiar with Mr. Brubaker, Ms. Nye from the Central Chemical Liaison Committee, and we've attended many of those meetings while they were doing the investigation of the site, the soils and the groundwater. My background is in geology and hydrogeology, and so I was hired by the EPA and from my work at Maryland to manage this project and several others. So I managed the groundwater investigation. They split the project into two around about 2007 to 2009, what they call operable units, soils and groundwater. And there were so many complications with the complexity of the investigation that they split the two out, and they had a record of decision that came out in 2009 for the soils to go with solidification and stabilization. And progress has gone on with that over the last couple of years in testing whether that's worked or not. But I'm not here to talk about that. I could talk about a lot of stuff, and I could get really technical, so I'm going to try not to go off on too many tangents. So what I'm here is basically to request access for us to deploy passive detectors in the in various springs and streams located around the city of Hagerstown. And I've prepared a presentation which answers some of these questions that were there, and I'm available to answer any other questions that you might have on it. And I have a presentation right here. And as Jim said, the two questions were, why is EPA sampling surface water when contamination is found deep in groundwater wells? And number two is, will the dye tracer turn waters in the city park, lake, Hager House Spring, or homeowner sump pumps green? So I'll answer each one series of slides. So I'll go with the first one. Why is EPA sampling surface water? And we've just put in a bunch of wells, and we went down. We're at a little over 400 feet on a couple of them, and some of them will come up with higher contamination at 400 feet. So to start it off right here, is everybody familiar with karst? You know, this is a karst area. As you can see here, the picture of the United States, there's a golden belt that runs up, and one of the parts is it's a textbook area for karst, which is limestone and dolomite type bedrock that is subject to dissolution, and it makes fractures widen from acid rain, and you get caves and springs and swallets and all kinds of topography that are associated with karst type terrain. And this is a generalized, simplified illustration, 3D illustration of a karst type system. Let me get my handy dandy laser pointer. And right here you have surface water comes around, and it finds sinkholes, and it migrates down directly to the water table, which is these dotted line right here, and then it goes into a conduit system. And the conduit system eventually goes out to a spring. And so what we've been doing with the drilling is we've been drilling, and it's really hard to find the conduits. You know, if you're drilling, if people put wells in around here, that you could drill one area, and then, you know, you get water, and another area you don't. And then if you get like 3 or 4 gallons a minute, but if you hit 100 gallons a minute, you probably hit a conduit. So, but they're hard to find. But the sinkholes are the direct pathways for the conduit system. And what we're proposing to do with this tracer test, which will probably start in May, is to actually, here's a little slide on sinkhole formation. I was getting a little ahead of myself. And basically, the water comes in, and the word is actually, it flows into bedrock cavity. Their word is spall. But, and then the cavity eventually gets bigger, and you get a structural arch forms, and eventually the structural arch breaches the surface, and the ground caves in. And it seems like there's been a lot of sinkholes in the news in the last couple of years. It just seems like they're always coming up now. But so over at the central chemical site, we have a number of sinkholes. We started looking at it, and we want to look at this conduit network and see where contamination that is on the central chemical site wants to go. That's the key, is that where does it want to go? It doesn't necessarily, if a mile and a half away, when you get to the spring, you don't necessarily going to have the contamination at a concentration that's a risk. But we're going to find out where it wants to go, and that will help us direct our drilling program if we need to do as much. But anyway, here's a couple of pictures we'll run through. This is the central chemical sign, and there's like two little grike holes, which are very small sinkholes. There are the site, and we did some trenching as part of the OU1 investigation, and at the very end of the trench, a sinkhole formed because standing water was in that trench, and then a sinkhole formed. There's a number of other like little sinkholes that have formed all around the area back in the woods. And then we have a whole group of people out here, state of Maryland, Jeff Harp, and Malcolm Field is in the red. He's going to be our lead investigator. He's a PhD geologist specializing in karst and tracer studies. And then there's another sinkhole over here. So what we're proposing to do is to pour the fluorescent dye into these holes, and then we're going to put detectors around in various locations. And this particular sinkhole right here is I took my camera and pushed it down that sinkhole, and that's what you see when you look down there.
Are the number of sinkholes here because of the prior use of the property, or is this common that you'd see this many sinkholes on a property like this?
There's twofold on that. There's in the Conococheague geologic formation, you do have a number of sinkholes. It is not the most prone formation to sinkholes, but it has the most because it's one of the thickest formations. So you do get a lot of the what I call grike holes, which are smaller, and we don't get quite the big collapses because the bedrock is tilted. It gives you a different type of collapse. But in broad areas, we get a lot of the grike holes as they're all connecting into the network. At this site, they had a lagoon which was about 20 feet deep and an acre in size. And as a fertilizer operation, they had highly acidic water. And then they would put that into the lagoon, and acid water makes dissolution happen even faster. Where they have, I think they had the U.S. Geologic or the Maryland Geologic Survey took a sample of their well, and they had at 300 feet they had a pH of 3, which is very acidic, and it's in limestone, and it's really hard to get a pH of 3 in limestone. So acid did play a role in maybe enlarge these cavities. So we're going to use them to see where it wants to go. And the process is we're going to mix up a bunch of this fluorescent dye and pour it down a sinkhole. We'll probably, at the beginning, we'll put some water in the hole, a couple thousand gallons, and then put the dye in, and then chase it with more water, simulating a rain event. And what we want to do is deploy these detectors, which I actually had one sent up to me, and I didn't bring it. I left it at home, but I was going to pass it around. But it's about the size. It was bigger than I thought. The detector inside of it is about the size of a cigar, like a Churchill. But the housing and everything on it is about the size of my arm from the elbow forward. And we would deploy these detectors inside some PVC tubing, so it's not readily seen. Some of these are going to be a little unprotected, so we don't want it to attract attention and have people take them. But they're fairly expensive. They're very sensitive to fluorescent. So if you have crystal clear water, it will detect them. It can take a reading every minute for 240 days in a row on the batteries and an SD card that's in it. So it's a very good type of detector, and it's a passive detector. And so This is a generalized three-dimensional look at a karst network that feeds a spring, and it just happens to have blue and green. And I'm using this thing. It's not necessarily that they designed, whoever put this together designed this to show where the fluorescent was going, but each one of these zones would be where we introduce the fluorescent into a sinkhole, and then it would travel along and then eventually comes out at a spring. And you could say the blue is other conduits that are coming together which are not contaminated, and they would tend to dilute the contaminant or the fluorescent by the time it reaches its exit point.
Is there sort of a map of the networks underneath of where we're talking about, or is that sort of one of the goals?
Well,
of
actually,
what you're trying to do?
I don't know if we'll ever come up with a map of the network. 'Cause, we went and visited Security Quarry at one point, and a few years back, when they got down to a depth of 300 feet. I mean, if you've ever seen that thing, it's like almost a mile wide, 300 feet deep. It's just huge. It's great for a geologist to see all the structure. But they found a cave at 300 feet, and the clay that was plugging the cave blew out, and a sinkhole formed in Antietam Creek, and it started flooding the the Security Quarry, and they were scrambling to try to fix it because it was overwhelming their pumps. And Dr. Field was part of that investigation, and some other companies that worked on it, and they eventually plugged the Antietam Creek with bentonite, and they were drilling trying to find the conduits, and it was really difficult to find them. I mean, it's 300 feet down, but it eventually makes its way up to the creek. So
Fascinating.
it's hard to find the conduits. We would like to, but it would be very expensive, and it might not work. There's other ways to do it.
So if you don't know where it comes out, how do you know where to put your detectors? Or is that what you're trying to figure out?
Well, that's what we're trying to figure out. It may come out in unexpected places.
So are you going to do this over a period of tests? Because like the pictures you showed of that one site, which is, I don't know, Central Chemical, 40 acres?
19.
Okay, so 19, much smaller than that. But if there are, let's say, 10 sinkholes, is the presumption within that area that all of that is going to one single conduit? In other words, if you're dumping this dye into 10 different spots on that 20-acre property, and you get it to come out in 15 different places, a mile away, a half a mile away at these different locations, how will you know, since everything's green, which one is feeding which location it comes out?
Well, I guess there were two questions in there. And one thing about this site is that where they had the lagoon, it's like the
right on the
top.
backside.
It's on for hydrogeologically, it is the top of a mountain. So water goes off in all four directions. It primarily goes to the southwest. It wants to go to the east towards the Antietam Creek and the Potomac River, but bedrock is in such a way that it can't go directly there. And alignments of bedrock is like out to Fountainhead Country Club and then down towards Hager Park, central Hagerstown. But it wants to go to the east. So we have radial flow. So depending on where we put the dye, it may go to one spring, but if we put it in another one, at say the northeast portion of the property, it may go to the north towards Rest Haven, or Fountainhead Country Club, and then some of them may go to the if it goes east to the Staley Park, or to the southwest towards Hager Park or Hager House, and other springs that are there. So we don't know exactly where it is and which ones are going to do what, and I'm leaving that up to our lead investigator to discern the difference between the different tests, especially if there's a huge delay on it arriving at the spring. It could arrive at the spring within a matter of days, or it could take longer. We don't know. if there was a 100% chance that it was going to work, I think 25% chance we're going to be very, very successful. And there's probably a 25% chance it might not work, but it won't find out where it goes anywhere. But we'll probably have mixed results.
What is the impetus for reaching a result? I mean, my curiosity is, let's say you put it in, it comes out in 3 places. What corrective action will that information provide you the opportunity to do? What protective reason is there for doing this?
Well, we're trying to protect human health and the environment.
Understand that, but I believe that the protection is largely so that the potable water supply of the population served, is protected from this contaminant. But the reality is, for the 80,000 people that are within the greater Hagerstown area, they're all served by a protected public potable water supply, not wells. So I guess that's what I'm trying to figure out.
He's saying what remedial measures, if I can help,
Yeah,
might this lead to, right?
Right, if all of our water is flowing in the greater Hagerstown area, in every one of these places through piped system.
Or in other words, what's the value of any
And
knowledge
there
that you
aren't
might
anybody
gain
served
from
by
this?
wells.
Well, if it comes out in Springs and then it goes in down the stream and into Antietam Creek, then it's essentially contaminating the creek.
It's contaminating Frederick's water.
No, well, I guess not necessarily. Well, could eventually goes down to the Potomac River and then comes down. So in aquatic life, people who may have been drinking from these springs years ago.
So I guess what I'm trying to figure out is, okay, it comes out this conduit. Will you attempt to plug this area, or dig it up and excavate it, or
Right.
that's what I'm trying to figure out. Once you know it goes through this area, what remedial action would take place to eliminate the contaminant from going through that area?
Well, this is a very persistent contaminant that's lindane and the isomers of lindane.
Right. So I'm curious, why won't we just go and dig it up and get it out of there?
Well, we went through that with all the community liaison meetings, and the state of Maryland wanted to have it dug up. The EPA came up with solidification and stabilization, and a cap. The solidification and stabilization is like turning it into concrete and it have certain leachability characteristics and strength and other types of characteristics.
It sounds to me like what you're saying is it's more infiltrating than what solidification would lend itself to secure the impact from.
Well, that's part of his source control, and that's not the only source on the site. And as far as eventual a record decision for operable Unit 2 in the groundwater, it's possible that we may go with some sort of groundwater containment, where we keep the groundwater below the level of the solidification, stabilization, and even at a lower level to contain the water on the site.
So if I understand that correctly, then what you're saying, if you were to do some type of groundwater containment, and you've identified that water is coming out in City Park through Springs, and water is coming out in Staley Park through Springs, and water is coming out in Fountainhead, et cetera, through these spring resources, I would assume that what you're saying isn't that you would create some type of groundwater system, containment system, that would preclude the flow of those spring systems to those park places from continuing to occur as they are now.
Well, it wouldn't do that, and I think we're getting a little ahead, but to answer that last part of the question is cutting off the source at Central Chemical isn't going to turn off the spring.
At City Park?
At City Park, because there are a lot of other networks of water that are going to go there.
Which may or may not be within this conduit
First-
you're researching.
What I wanted to say is we want to find out where it wants to go. And as I pointed out, that it gets diluted as it gets farther away by more and more fresh water. And so it may not come out at a concentration that is toxic to people or animals when it comes out of the spring. What we would probably do if we got positive results is collect sediment samples to see if there are any residuals in the sediment. And then we would collect samples at times of high water when the springs are flowing hard, and to see if we detect concentrations coming from into the springs. And we would determine how much of a risk that is.
And we're not able to do that with simple, basic water sampling tests of those various locations now without dye testing it?
Well, the dye testing is, like I said, it could come out in unexpected places. And the water sampling has to be done at certain times. And right now, we have to delineate the extent of this plume in order so we could put institutional controls on drilling and extracting the water so that people are not becoming exposed to it.
Which nobody in Hagerstown is, because nobody drills wells here. Everybody's on a potable
Well, there
public
are
water supply.
up by Fountainhead Country Club, there are a lot of irrigation wells that are there, and then it's potential across Route 81. There are other wells that are out there, and we did residential wells. We're about to do some residential well sampling up in the Fountainhead Country Club area in this beginning of May. So we are definitely looking into that to make sure that we were looking into doing those wells in the Fountainhead Country Club well in lieu of drilling more wells to the northeast. This will get us to the end goal faster than drilling alone. And there's the conduit network, and then there's a fracture network. And the well drilling that we're doing is finding out what's going on in the fracture network, not necessarily the conduit network. And I can move on to the, so we get too far off. These are the locations, at some of the locations that we're going to put. We have 25 of these detectors, at least, that will be out there. We have, there was sampling that was done in 2005 over at Hager Park, and the water's actually kind of green there in the summer anyway. And we have, the Hager House, and we have Staley Park, and Rest Haven and Fountainhead.
Right, Hager Park means City Park here.
City
correct?
Park, okay. Okay, Hager Park, okay. Sorry about that.
That's all right. I just want to make sure citizens are clear.
So, and then we get to the question is, will the tracer dye turn the waters in the City Park, Hager House, or homeowner sump pumps green? And the answer is, it's unlikely, but it's possible. The thing to know is that fluorescent is a non-toxic food-grade dye that's used to color green beer on St. Patrick's Day and turn the Chicago River green. It quickly photodegrades in sunlight. And what we're looking at is the pesticide plume, the lindane plume, is highly toxic. And you can't see it, but it is highly toxic. It's used to kill lice. If anybody's had a lice problem, you can put it on for 10, 15 seconds, and you got to take it off.
Yeah, I mean, that third statement there just seems a bit out of place with the other two. I mean, the question is, what can we expect from the green dye? And I'm trying to fit that third statement. This pesticide plume is highly toxic. I mean, to me, that might mean one thing, and to another citizen, that might mean an entirely different.
Well, I put that
highly toxic. I'm not certain to what degree you're talking about here.
I think what he's saying is, compared to the pesticide, the fluorescein is like food compared to that.
Yeah, I understand that, but what I'm saying, are you saying that this particular pesticide plume is highly toxic, or that this?
I'm saying any pesticide plume is highly toxic, but this particular one is highly mobile, and it's highly toxic. And it's, if you look up the risk screening tables on the EPA Region 3, and they're basically set up for Will it cause cancer in 1 in a million people? It's conservative, but it's a number that goes for a whole list of chemicals, and you could see how toxic they are relative to each other. And this is one of the lowest numbers that's out there. It's toxic in the parts per trillion. Yeah, so if you had to say the risk screening level for technical BHC, or it's lindane or hexachlorohexane is the actual real name, is 0.022 micrograms per liter, or 22 parts per trillion. That's at 10 to the minus 6, or 1 in a million. At 10 to the minus 4, that would be 1 in 10,000.
Well, so not the more of a rhetorical question than anything else, but when I hear what you're saying, it seems to me this site's been under EPA or whatever for 20 years, and we're now finding out we have potential for a highly toxic plume that 20 years later we're going to start looking for. The reason it's taking so long to find out whether we have highly toxic chemicals polluting our groundwater?
It's a very complex site. It's very complex geology. And it has the right people who are doing it at the right time. We're getting to this particular point that we found it. And we went out and did a lot of drilling back in
okay, so what you're telling me is because what I think I'm hearing is this is a relatively new find. Is that what you're saying?
It's not a new find. It is an understanding that this is a karst type of system, and then going and looking at everything that needs to be done in a karst system. I mean, according to the American standards of testing, that this is, if you look it up, tracer testing is one of the recommended ways to go, because it goes and looks at the conduit network.
I have no doubt. I mean, my big question was why we didn't do this 15 years ago? And again, that clearly is much more of a rhetorical question than something to expect you to...
I think when it comes down to doing a Superfund site, where the potentially responsible parties are in the Fortune 500, chemical companies, and they have a lot of lawyers, and they, for the first couple of years, it was all talk back and forth. Whether they're going to do it. Then they finally agreed to a work plan, and they did it. But then they didn't do it. They didn't do the right things that needed to be done. Then they have to be reviewed, and then it has to be, then you have to come up with a work plan that's acceptable. And there were so many arguments in between, that the project manager for EPA punted on the groundwater so that we could get to the point where we are now with the soil and get there. So now the groundwater is coming back to life. It was apparent to me and other people, that they had not gone deep enough, and that they were not delineated. And I wanted them to do tracer testing.
Thank you.
Okay.
I mean, again, it wasn't directed at you of why haven't you done it.
Sort of
and you answered the question. I'm familiar with Superfund litigation, so that's, I understand.
So given that Central Chemical created more chemicals than specifically the one that you are citing as being a potentially, highly toxic pesticide plume, is this the only one you're as highly or as specifically interested in identifying or tracing the path of? In other words, clearly Central Chemical created many other chemicals through the life cycle of the plant at that location. Is the lindane the one that's that's the one on the list, or is it just one of a number at the top of the list?
It's the driver, because it's the most toxic and it's the most mobile. There are other, closer to the site, there are other chemicals, and all the DDTs are there, and they don't tend to migrate. They tend to stick to clays and soils, but nevertheless they still have some DDT in the water, but it's close. to the site, doesn't go quite as far. It could
Okay.
potentially go farther in a conduit.
Can I try to summarize how this works and
Okay,
see
go
if we
ahead.
have it right? I have it right. You have certain known spring outlets or outlets in these locations that
Mhm.
you're going to put the detectors at. Then you're going to put the dye substance in one sinkhole at a time, so you see how that links? Or are you going to do the whole site?
No, we'll do one at a time.
One at a time, so
We'll-
you see where it potentially comes out.
That's just good
Right.
science, Marty.
Well, I'm just trying to, make sure we understand that. But I still hear that the water could look funny when it first comes out.
There's a potential.
So we still could have people like, what's happening,
And you'll have that, because when they
Jack
go
Berkson.
in and they do the pipes on the street, and they'll say, "Ooh, everybody
smoke
watch,
test. Yeah,
don't wash your clothes, okay?"
Yeah.
Because we have muddy water
Right, well, it won't be
today,
in-
so.
but
But
it
I'm
won't-
just saying,
it won't be
but it'll be.
anybody's faucets, but it'll be out there in the public area. It could be, especially when a shady area where it comes out,
Yeah, the same
Doesn't have
issues
the
that
sun.
we have with smoke testing.
Yeah.
People not aware of it, and we had
If they don't know.
some freakouts about the smoke testing before we even did it.
And I would try to camouflage those detectors as well as you could.
We will try to do that
I would
there.
highly advise that you camouflage.
Well, thank you for your
Yeah.
expertise
Thank
and
you.
your
Yes,
presentation
appreciate
here
it.
tonight. I do want to call the question and find out if anybody objects to the request to enter right-of-way and grant that authorization and install those detectors. Anyone object?
I don't, and I appreciate the presentation. I think it was very informative. I learned a lot, I can tell you, and I appreciate it.
Yeah, and thanks again for waiting.
No problem.
Aquifers are amazing and interesting. I wish I knew more about them.
It's a fascinating site.
So staff are going to coordinate with Mr. Wallace and get the agreement so we can get it signed and get moving. Thank you so much. Thanks
thank
again
you.
for your patience. At this point, I want to pause because we have reached the 7 o'clock hour and see if there's anybody here that came for the public hearing that may not have had a chance to speak. We had a public hearing regarding the moratorium on ambulatory healthcare services in the CCMA zoning district. Anyone?
I checked the hall and there was not anyone.
Would you like to, sir? Would you? Oh, okay. Well, welcome. Okay. Okay.
It'll be
well,
on
if you'd like
television.
to make a statement, you're certainly welcome to. You can also watch the video on YouTube for the part of the hearing that you missed. Anyone else? Okay. Moving along, the next item on the agenda will be the enhancement to rental subsidy component of the City Center Residency Initiative. Thanks, Mark. Thank you.
Yes.
Good evening. We wanted to discuss with the mayor and council some potential updates to the City Center Residency Initiative program. Just a brief synopsis of the program. There's two distinct components of the City Center Residency Initiative. One is a down payment assistance component that offers up to $10,000 for a loan to grant for eligible homeowners who are looking to purchase a home in the City Center Residency Initiative area. And then there's also a rental subsidy component that offers $150 per month for an eligible City Center residency applicant to rent a dwelling in the City Center Residency Initiative area. Folks who are eligible for the program are recent college graduates, active members of the military, or someone who's been honorably discharged within the past 12 months of their application, USMH students and employees, government employees, degree-holding professionals, and also households that have a household income that exceeds 80% of the area median. If the mayor and council, if I can refresh your memory to last October, the mayor and council had approved the edits to the down payment assistance component of the residency initiative program. And tonight we wanted to focus more on the rental subsidy component of the program. We worked with our housing work group on this program, and we've also had discussions relevant to some of the urban partner discussions on the rental subsidy component of the program and also the home ownership component of the program. And some of the feedback we were hearing was that the current incentive, although it seems to be a program that would be attractive, that the incentive should likely be targeted in certain areas and then also offering a more substantial incentive for those targeted areas. One of the other barriers potential barriers that we were hearing from the housing work group was the rental subsidy component as it currently stands now requires a 2-year commitment, although the subsidy only is good for 1 year. And one of our recommendations here tonight is to actually remove that 2-year commitment. It would just be a 1-year commitment for an eligible city center residency renter to be able to live in the city center for 1 year, and that they would receive the incentive. Although it is a little bit counterintuitive, we're talking about concentrating. We did want to expand a few areas of the existing boundary, and the reason we're looking to expand, if you can see on the map, the small areas on the bottom left corner of the map would be the 200 block of South Prospect Street, and then also believe the 200 block of South Potomac Street. And those areas are somewhat in line with the urban partners study that identified those areas for home ownership, but we also feel that these areas are heavy with rental properties that would attract city center residency initiative applicants to rent, may also attract them to maybe utilize those areas as home ownership in the future as well. And we feel the South Prospect Street area, it's just a unique neighborhood and it doesn't really make sense to divide it.
Seems like a really random division there.
Correct.
Too.
And the expansion boundaries that are proposed, it actually essentially makes the new city, if it would be approved, the new city center residency initiative area almost identical to the police incentive that's, I think, slated to be approved next week. The highest concentrated area, the police incentive, which would be the $300 area for police. And police would also be able to utilize, on top of the police incentive, the city center residency initiative area incentives. So that's basically, in a nutshell, the proposed updates. Just a couple other things to note. We would recommend keeping the entire area in existence and still offer the $150 incentive, but we would also like to focus on a priority area, which includes the blocks on Public Square on North Potomac and South Potomac Street, and then also 2 blocks of East Antietam Street. We see this area that is some of our marquee businesses and restaurants are in these areas, and we feel that attracting city center residency initiative tenants to that targeted area can only, not only help those neighborhoods, but also help maybe bring more patrons to those businesses.
The stars that say potential CCRI rental units, how did you determine those?
Those were just for demonstration purposes, and I think what we were trying to show there is if you look at the target area, we think if you have more of those potential units or potential applicants utilize those areas for for a new rental dwelling or to make that area their choice to rent, you have more of a concentration and maybe more of an effect on a neighborhood. But if you would have those scattershot throughout the existing area and that was the only area, it may not have quite the impact that we're looking for.
And you've got a dozen just in that
Yes.
priority area.
Yes.
Would it be 1 year or 2 years outside the priority area? It's 150.
Yeah, our recommendation is everything would be 1 year.
Everything be 1 year.
But
Boy, that's.
Yeah.
I mean, there's that much transience, huh? Or reluctance to commit, or
yeah, and since 2004,
that kind of subsidy?
Since 2004,
Or maybe they want to buy a house, Marty, so they just want to rent for 1 year.
Yeah, we're taking into account, one, the population. We're targeting young professionals who may be more apt to move, especially if it's a recent college graduate. And also, the existing incentive with the 2-year commitment, we've had roughly 15 renters take advantage of the program in 10 years. And I think we'd rather see more people utilize the program, even if they would happen to leave the area after 1 year. I think it would be a good problem to have if we have folks at least coming in for 1 year.
So 1 year for both the priority and the
Correct.
Existing. All right.
Any
I
other
think the
questions?
I think the main thing is it hasn't been utilized much, and we need to try adjustments.
I agree. The other point here, this down payment assistance component that we put in place, I mean, this is obviously regarding the rental stuff, but
Yes.
it says here you haven't had great success, as you've alluded, on the rental side. Am I to infer that we're having better success on that side of things?
I think our records indicate, if my memory serves correct, that we've had approximately 20 applicants that utilized the down payment side of it since inception. Since we
So
did
20
make
people in
10 years.
Okay.
The mayor and council would approve the more substantial incentive for that side of in October, and we have had one person already utilize that.
The approval that we had, though, back in October, is that confined to this specific area as well?
Yes. But we would anticipate that they would also be eligible if the mayor and council approve the edits to the boundary, that it would be the entire area would be eligible for.
When you say the entire area, you mean the entire area in red?
Yes. And then the two green additions at the bottom left.
For purchase?
Yes. Because we
Okay.
think that aligned well with what Urban Partners was saying is
Okay.
potential home ownership
I got it.
areas as well.
Got it.
Any other questions or feedback for staff? Marty gave the thumbs up. Everybody okay with him? Sounds good. Good work.
We
Yes.
do not have this on the agenda for next week's regular session. We could either maybe add that to the agenda if the mayor and council would like, or we could also just shift it to May.
If we can get it together. let's
Yeah, I'm
do it
fine with
next
adding.
week.
Sure, let's do
Sooner the
it.
better.
Okay, we'll have it ready for next week.
Okay.
Thank you.
Thank you.
Thank you.
All right, community gardens. This is an issue, I don't know if it's near and dear to my heart, but it's certainly of interest to me. I appreciate the fact that Rodney, our engineer, Aaron Wolf, Junior Mason with our Parks Department, we've been meeting, and I think, well, as the memo says, we did a survey, found that there is some interest. I know that we've tried community gardens in the past, and those have failed. I think we've done some good work in terms of getting feedback and finding best practices across the country, and finding out why those didn't work and how we can make something that is actually a success. So I'll turn it over to Rodney. Thanks.
Well, Mayor, they are popular in other communities. I was just sitting back here reading. Magazine came today, National Recreation and Parks Association. Talks about of the people, the communities that are members of this organization, over 50% in this article, over 50% run community gardens, over 80% rent space for community gardens. So they're across the nation. They're very popular. And again, we did want to try to find out from our community whether or not there is any interest out there. I'll let you be the summary results are within your packet, and I'll let you interpret that. But if we want to move this issue forward and study it further, what we would suggest is that we have a public meeting to invite people to come in, and as much as anything, give us feedback as us telling the community what we think, as we invite them to hear what they have to say, have a dialogue there, and then eventually get a group that would work with the staff, Junior and myself, to study this issue and come back in maybe this fall with a proposal and to answer a lot of the questions that would be surrounding this issue of how they operate, how they are managed, how do you keep them secure, et cetera. I have a whole list of those things in my memo. So I guess we just like to find out if it's something you want to move forward or if we just want to move on to something else.
You had some suggested next steps, which I think are good. One of the things I think is important to mention is that there are grant funds available out there. So I would continue to seek grant funding and donations from local businesses as one of the next steps.
And Sustainable Maryland might have a grant program that we could tap into as well, possibly.
And so the idea is this would not be a financial burden on the city. We want to try to make it as cost neutral as possible. We talked about, at some kind of nominal fee to help cover with costs, which also increases the ownership stake that people feel in their membership in a community garden. So
I talked to one group out in the Midwest, actually, that these are supposed to be very successful, and they said their biggest startup cost was actually the fence to secure the place. And then after that, you have some ongoing costs with water and things like that, but the rental should offset most of that, so.
And just so everybody knows, has anyone here been to the Spring Garden in Philadelphia? Anyone familiar with that? Anyway, the issue of the fence, I think, is important because obviously security is a factor in this. But the last thing we need is a chain link fence around anywhere in the city. So it's been my recommendation that we try to find something that can be more on the artistic side. So if you Google Spring Garden, or maybe Erin can, I know she had pulled it up online, maybe she can send me that link and I can share it with everyone to kind of let you see what I'm thinking of in terms of if we're going to do something like this, how we might make it even nicer addition to the neighborhoods. Mr. Brubeck.
2 comments. Watching these over the years and actually doing some, there's often a lot of initial enthusiasm, fades off, a lot of neglect. I'm not saying you know the answer, but that's traditional.
Yeah.
And water at the site. Water at the site.
Have to have it.
Have to have it, yeah. So those things, and I thought the verbatim comments were kind of interesting.
Yes, some of them were very interesting.
Marty, Mike.
Yeah, I wanted you to see all those. Were the ones that you were familiar with, was it a community garden where like all of us would work on the same plot, or was it each individual group?
Individual plots.
Yeah.
Are we looking at this at one location or how many
Within a large.
locations?
Probably start with one.
Okay, that's what I mean, you know.
I think
so
that the one that we discussed the most would be in a location right across from Bester Elementary School on some city-owned property because it's in a neighborhood where a lot of people don't have a whole bunch of yard. It's near the school. It's also near some other public parks in the area. That's the one we've talked about the most so far. Mr. Alshire.
I mean, looking at the survey, and I saw the survey online, isn't as, for me, as telling as reading the comments. I mean, the comments are pretty obvious that there's a lot of people, and I think Marty points it out pretty correctly, there's a lot of people think it's a cool idea, that only about 1 in 5 indicated the interest in helping, and that interest, if you start out with 1 in 5, as our experience has indicated, wanes over time. It was interesting the number of folks that identified themselves as older responded to the survey, and the number of folks that said, great idea, can't help out, sorry. Or out of town. And then the other thing that sort of stuck out in your location choice was the number of folks that commented that either they have their own already, and also of the locations you sort of put out there that you need an open field with no trees around. And for me, I think of the number of properties that the city owns that fit that bill, and most of the parks identified don't fit that bill largely. Maybe Bester does, but I think in addition, and I'm not in favor of this, but if you're going to do this, I hear us saying behind Bester or behind the property across from Bester. I would only say that folks that actually live in that neighborhood have some awareness, because I just think that this is a type of activity that garners a different level of when people say I'll do it for more than an hour a week. I have a garden in my house, and it's no hour a week. I mean, it's 2 hours.
I agree. I have gardens
at least 4 or 5 times a week, and so that I think is probably part and parcel to the reason that it wanes more so than the lack of interest. The only other comment I'll make is there was a question about an orchard, and before we would even venture down that road, an orchard is a very expensive, tenuous sort of profession. And I would talk to the orchardists in the community, and get some real candid feedback on the care it takes, which is, way above and beyond, the care of a garden.
There's some things I think that take tremendous amount of time.
Yeah.
Chemicals.
Right.
We would want to avoid. There's some things that might be simpler, such as blueberries or something like that. But we could work through that.
Blueberries or strawberries, but Janet Bartell and her husband, Janet Bartell and her
Well, we
husband.
could identify one of those conduits.
Starting over again. Janet Bartels and her husband had the one over at Vester Elementary School. And I know that there were some families that were involved in that. Trying to get the other one to get up and going that the other councilwoman had started.
Right.
It was very difficult to get anybody to actively go into doing it.
Memorial Rec, not Memorial Rec.
No, this
Anticipated
was
the one at
this.
Hager Park and-
No,
or
this is the one
Hager
at Hager
House.
at Hager
Okay,
Park.
okay.
You know, no, because they had an offshoot. Janet and Gordon had an offshoot at Memorial, as well as she also went out to help at Hager Park. But you really have got to have people that want to be involved in it,
I think that's
or
one of
we're
the
gonna.
issues is
Well,
that
I
when
mean,
have
you know.
one big garden that you expect everybody to sort of show up and help.
I know.
As opposed to your own plot that you're paying like a membership fee to be able to do some of that. I think that's a different model.
As
that we
long
haven't
as,
tried
as
yet.
long as honestly that there's grant funding and for the private
Socialism and
to, to add into, then I can see it. But as far as
Are
taking.
you guys reading number 35?
Oh, my.
I'm sure.
As
Number
taking
35
out
of the
of,
comments.
as far as taking out of the coffers,
I think they're in that.
Right. Well, I mean, and my goal in all of this is to keep it cost neutral to the city. So if we can get
Yeah.
as much grant money and donations from local businesses as possible, I think that's the way to go. There may be some costs, in terms of water, the fence, those kinds of things that
well,
we can
tell
try
me,
to-
because I carry the water to the almshouse to take care of flowers in spring and summer down there. So I know all about it.
The other thing is, what's being recommended is that we
my
have this
dime.
public meeting. I think there's a draft flyer for it. We're looking at Monday, May 12th. Is everybody okay with moving forward with a public meeting and then bringing a recommendation up for a task force? It seems to be an effective model that we use with trash and recycling and the dog park to create that core group of people who can create the enthusiasm and the
Yeah,
vision.
if there's a core group of people, that would be very good, but I think that.
Is that core group also going to participate in the garden?
Well, that's what I
That
think
would be
you need,
assumed.
that's what you need to have.
Right.
You need to have something like the dog park is
When
a
again, I think
prime
all of-
example.
all of
You can't
this
have
is-
that type of
Right.
citizen.
Well, they went out and raised money. I mean,
Right,
this
right.
is obviously dedicated people. But I think we want to learn from all the best practices we can glean from other communities that have done this to find out what's helped them be more successful. I think the ongoing management structure is going to be very important in terms of its long-term success. I can just say that my friend, when he was in law school in Philadelphia, was on a waiting list for 2 years to be a member of the Spring Garden, and people, and it was only like $25, $35 a year, but it was so popular that they had a waiting list. So that's my vision, is that we have such a nice garden with waiting lists for people who want to get into it.
Mike is good at waiting patiently.
All right.
So we're okay to
Any other
proceed?
comments?
Okay.
Okay.
Have the meeting?
Thank you.
Okay.
Kristen's going to be there, right? May 12th?
You can easily plant it over in grass.
If I may, I'll give you the condensed version.
Yes.
Please, please do.
Tom Maestry's here. I have to
Hi, Tom.
recognize him. He's always with us up from
You're
Baltimore.
Joe.
This is Joe. Tom's sitting in the back.
Another patient
He
one.
has the patience of Job.
There's Tom back there. Yeah, okay.
We developed a joint RFP with Centigro. We're operating under the auspices of the recently approved contract with Centigro, which was a 10-year extension, whereas developed an RFP. They put it out on the street, but they utilized all the city procurement policy. So they operate exactly as we would. We were fortunate. It went out to 7 bidders. We did get 3 bids back. Chose the bidder that was most consistent with what we were looking for. In our recently completed 5-year rate study and in our proposed budget for this year, we have $1,050,000 designated for the CIP 711. We have $122,000 left this year. The project came in at 800 and some odd thousand, and then the 15% for the work that Centigro does for us with overseeing the project took it to 944. So we are about at $105,000 under the proposed budget. So I have the motion written as such to for us to utilize the funds that we have in the proposed budget, and it gives us a notice to proceed to go ahead with Centigro. The payments are over a 12-month period. We expect the project to last, so it's not a hit on our budget. They're tapered out over that time frame. It's for a sludge holding tank that we're woefully in need of. It's restoring an initial tank that we have on site, which is approximately 250,000 gallons. It gets a new cover on it, an odor contamination blower system. There's piping, of course, instrumentation that goes with it for our operation. But it's something we've had designated in our plan for years and are finally able to move forward after we're finished with ENR and our other projects. So that's what we would like to move forward with if the council agrees, please.
Do we get any increased revenue from this?
This will help us in regard to some of our chemical usage. It should help us because some of the waste-activated sludge that goes back to the headworks will be reduced, so it'll help us in chemical treatment mostly.
So efficiencies.
Yes, sir.
not
It's
revenue.
operational
We're not
efficiencies, not
selling it
revenue.
off-site.
That's correct.
And it's part of a 5-year schedule.
It is part of the 5-year
Improvements
schedule.
to
That
the
is correct, to the facility
plan.
itself.
Any other questions or comments?
Thank you
Appreciate
all.
your work.
Yes,
Thank you.
Thank you very much. Yes, sir. Thank you all.
Thank you for your patience. Well, that is all the items on our agenda for the evening. I will turn it over to the city administrator. And look at this, we are right on time, gentlemen and ladies.
No comments from me this evening.
Okay, who would like to start on the council with comments? Mr. Metzner.
No comments from me this evening.
All right. I would like to say that I'll be going to the temple this Friday, having
Yes.
lunch with the rabbi and
Dinner.
celebrating with the community Holocaust
great.
Remembrance Day. And we will also be celebrating that next Tuesday. So I'll comment for you on that.
Thank you.
Wasn't that was so good of you, and how did he rate that? Because he's the mayor? Mm-hmm. Okay. My first statement is, and after seeing those that have been hit by automobiles on the dual highway, we still have people that are still on the shoulder of the road traveling the dual highway. So I don't know, is there anything going on with this? And not that you're going to be able to stop it, but does the police at least say, would you take a different route? I mean, I'm seeing them with shopping carts that when they hit one, they're going to hit all. And I don't, it's become a concern for a lot of people that call me. And what is it that we're doing about it? And I don't know that we can do anything about it.
Well, I do know that the city staff has been pretty aggressive in pursuing these state funds for grants for sidewalks along state roads.
And I know, Dave, because
So,
I know that you had been after sidewalks for a long time.
They're
yeah.
getting done. There's still some critical sections that aren't done, like
It is.
from Cannon on Washington east, towards the Venice.
Yeah.
There's a stretch there that doesn't have any sidewalk that's around the curve, and
Frederick did that too on the Golden Mile, and they eventually had to put up
the
black
fence. Yeah.
wrought
Put
iron
up to do-
fencing or
yeah,
whatever.
because,
Like
I
the other
mean-
night I rode by when that happened.
Oh,
And clearly, the difficulty in this and the two other cases is they're crossing at locations
Yeah.
that aren't identified
As
I don't know what to call them, crosswalks.
Right.
There's 8
But
lanes
it's also
wide,
the
but-
product of poor planning from the past, let's be honest. Because
Well,
when
and-
you
yeah.
look at Edgewood and Robinwood
there's a lot of
up
ins and
there,
outs.
you
Yeah.
have high-density residential on the east side
Right.
of 40 there, or whatever that is, north side. And then on the other side, you have a grocery store and all the services for those people. They're not going to walk down to the intersection to go to the crosswalk that may or may not exist there
No.
now to go up to the shopping center. They're crossing right there, right where the traffic turnover is for westbound people to go into the shopping center. So it's
Well,
a mess.
it was brought up, so I brought it
I
up.
do see people walking to and from work,
Oh, yeah.
all the way from
Well, I
the
mean,
London Town
when they're
Apartments.
moving shopping carts, so, they're within the area out there somewhere, and I've actually seen that.
To watch people in our community decide not to use the sidewalks,
Right.
they decide the bike
And they-
lanes
and they-
are the way to walk.
So that's
and-
why I say we need to educate
Or
our
the
public
travel
about
lanes,
pedestrian
sometimes, the
safety.
highway line.
Yeah. It doesn't, it doesn't really matter.
I've seen people right on the edge, right on the pavement.
I talked to Rodney about that this morning. He said there is a meeting that they're trying to schedule a state highway in the county, since some of those areas of the dual highway are in the county, to
Yeah.
talk about this.
Well, that's important for people to understand about, I'd say about half the stretch in from 70 to town is in the county.
And it is not the state's responsibility to build sidewalks there. It is, and this is what I try to get across to the reporter who did the story when he called me, it has to do with planning and what you require a developer to do. And the city requires sidewalks, and the county at this point does not require sidewalks, even in the urban growth area, which is one of the issues I think we should address with the county. But important issue, thanks.
Okay. The other issue is that the first fire truck, it will be in the budget that we are now going to.
Yeah, we have 2 ladder trucks. These aren't
Correct.
the engines, these are the ladder trucks. One scheduled for the coming fiscal year.
Okay.
And one coming in FY16, which
Okay.
would be 15 and 16.
All right, because what did we have to borrow again? We had to get one
We
from
had
Montgomery
to
County.
borrow, for a couple days over the weekend, we had to borrow a ladder truck
Okay.
because both of ours.
All right, I just needed to know when the whole time frame was. And also, when Andrew, and they were talking about the apartments down here, and I had been approached by 2 individuals, and that had to do with rent control. And I said, I don't know that there was ever anything that I realized as far as rent control in this area. I know that New York had rent control, and then once in that area up in New York, and that would be down in the Manhattan area, that once a person dies or whatever, then it's off of rent control. I just needed.
It gets passed on regardless.
But
People figure out
it depends. It depends. But the individuals had asked me,
Yeah.
and said, well, could you please say about looking into this? And I don't think that
I
is.
think we actually have the opposite problem in Hagerstown.
I don't
is
think
that our
that's
rents
our-
are too low. They're not
Well, but
so high,
well, I'm
it's
just
forcing people out of
I'm
their
just
homes.
saying, okay, because I don't think that's in our purview, is it? I didn't think.
something we could, we could always look at it.
Well,
I don't
I'm
know if
just
it's
saying
feasible
that
or
it
not.
was approached, and the only one that I ever remember was up in New York, and my daughter's friend, her father
I
had
just
a
don't think
place
it's
up there.
necessary here.
Yeah, and Antietam Street, from the library down to Locust Street, the kids are just really out of control. We've got vandalism that's going on, and that would be mostly on the side of where Kaufman Funeral Home and the hair salon and the apartment buildings. They're in and around, these kids are into yards, they're doing a lot of vandalism. It can go on from after school till after 10 o'clock at night. So, do we have 2 police officers now that's in the area too, that's been added
Yeah,
into?
what the chief was saying is he's got the 2 additional officers
Okay.
downtown, so they're starting to focus on some of these
Okay.
young people
Yeah,
issues
and
like
that's where it's at,
we've
and I mean,
seen
you're gonna
in that
see it,
area.
you're gonna catch them from the alley. The alley's the biggest, where they're doing a lot of it, so. I think that was it.
All right, Mr. Alshire.
3 things.
There was another thing.
Go ahead.
Go ahead. ma'am.
Okay, out-of-state cars. The ones that are living here, that have lived here for longer than, and what's the time frame? that
30
you're
days.
supposed
30
to-
days.
Okay. At one time, we had a grant that was in place, and the police could go forward. And we had one police officer that was very good at doing this, and then the money dried up, okay? I know that, yes, in fact, the money does go to the state, but I would like to know if there's any way that the state can look in at helping the city of Hagerstown, who has got a lot of cars that are West Virginia and Pennsylvania. And they're here for a long, long time. And if you honestly go around your streets where you live, just take a pencil and paper with you. It's amazing. But what my question is
Can
there
the
any way
state
that we
help?
could actually get any help from the state?
To enforce their motor
To
vehicle
an-
laws.
yeah, because it's money in their coffer. But what it took from us, that if the person didn't do it, then it would have to be towed, and then that's where the money came in that we had to pay. That's it. Thanks.
Gotcha. Kristen.
3 items. The first is, I think the mayor, maybe others, got an email about the taking down of some of the cottonwood trees next to where they're building the new Bester. And so, while I'm not opposed to the removal of trees. I think that that's a particular type of area where the public would notice very quickly trees of that nature being removed. And so I think that the better we can simply explain that in some public manner to the citizens, the less, we have to sort of account for that after the fact. When Tom sent me the email, I didn't know anything about it. Maybe I just missed it or something. But, having the ability to explain to somebody when they drive by and see 6 less trees that have been there for, longer than we've been around, is a good thing, a good type of information to have. The second is, while I know, we're not making remarks on the public hearing that we had earlier, I only wanted to say that tonight's public hearing was a good reminder, at least for me, of the necessity to be able to hear from all perspectives of an issue, and exactly why I think that we have public hearings. So I appreciated everybody that came out and spoke. It definitely gives me a broader understanding of the issue, and I can't help but thinking after listening to those folks, and I understand we're going to have more discussion on this type of issue and all of the uses that we talk about, especially in our urban core. But I think folks generally agreed we're sort of on the right track of what we're doing, but we may be riding the wrong horse on this issue, and I don't know how else to say that but to put it in that context. And so I hope that we can get there with some reasonable approach. And I don't think what we've considered in what we've looked at of saying, hey, give us the opportunity to really look at compatibility issues is an egregious process to go through. And then the other is, everybody got the notation about the assessment appeals. I'm sure there are more than that, but those were the big ones. And one thing that I found interesting in that assessment appeal was, it really was 65 listings, but really only of a few owners, largely owners that you don't really know the names of because they're mostly corporations, but a good number of them were larger apartment complexes. And so, I don't know what role we play in that type of appeals process, but, I don't know how else to say this except that, there are a number of homes around the city that you look at and you say, okay, that home, is paying $6,000 a year in property taxes, and it's, largely because of the size of that home. And then you put that in context to the level of service, city services that it commands versus, a large apartment complex, that is commanding city services as well. And I'm not certain that, they add up as apples to apples as we would envision them to be. So, just
I
maybe
think the whole process seems broken, honestly, because you might as well
it was
just
interesting.
Ask people what they think their property's worth.
Yeah.
And then assess based on that.
Yeah, because
I mean,
a lot
if
of
the
them actually
income-
went down, and they're still appealing it going down $500,000, which I thought was a little odd. I think one of them dropped like $3 million, and they're still appealing that it dropped $3 million in assessed value. And you're thinking, okay, I know that location. I know, I have an understanding of the level of service, that commands, and it's interesting to see. So.
All right, thanks. Mr. Brubaker.
No comments tonight.
All right. My comments are that, first, I want to say thank you to the Parks and Rec staff and all the city staff. I finally got my T-shirt for doing the Hub City 100 miler. I did do 100 miles in 100 days, probably did more than that, but I was really bad about filling out my tracking form. So if you did do your tracking form out there, if you're listening, please turn it in. They do want to keep track of that. I have talked with Amy in Parks and Rec about how to make this better in terms of maybe creating an app for your phone so that you get a daily reminder to log your miles, or to somehow digitize or make it electronic to make it easier for folks. But it was a great effort. I think we had, I missed the finale, but I understand that it was great. And, you know, just thinking back to when we started it in January and how freezing cold it was and the amount of people that showed up there and the enthusiasm, I can't wait for the next one. So I want to congratulate them on that and everybody who participated. Today is Earth Day, so happy Earth Day, everybody. We had a celebration at University Plaza yesterday. Council members Metzner and I were there also to celebrate. And so I declared this week Earth Week, and today Earth Day, and also wanted to remind folks that this Friday there'll be a celebration for Arbor Day. Also, Taste of the Arts is this Thursday. It's from 5 to 8. You can buy tickets at the Maryland Theater. It benefits the theater, the Arts Council, and BISFA. So just wanted to put a shout out to that as well. And with that, if there's no other comments, we will be adjourning the special session and also adjourning our work session. Thank you.